Good evening, everyone. Thanks so much for joining us tonight. Sorry to be a couple minutes late. We're just wrapping up the executive committee immediately prior to this. Welcome, everyone. The hour of 7 o'clock having arrived on this 21st of July, a Tuesday in 2020, I will now call to order the City of Racine Common Council. The first item on the agenda is actually the Pledge of Allegiance. If everyone could please rise and face the east and join me in the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, everyone. Alder Tate, do you know of any absences for this evening?
Alder Jones says she has to excuse herself after delivering the Public Works and Services report, but otherwise, no.
Okay, thank you very much.
I do believe Alder Levy had sent an email saying she might be a few minutes late.
Yes, and Alder Levy did inform us that she may be a few minutes tardy. But let us begin in earnest. The first item before us is the approval of the council minutes for June the 2nd, 11th, 22nd, and July the 8th. At this time, I would entertain a motion to approve those items. Alder Young.
So moved.
Is there a second? I see a second hand raised from Alder Coe. We have a lot of participants listening along today, so I'm going to unmute everybody. All those in favor of minutes, please say aye.
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 Opposed? That motion carries. We will now move on to the agenda. We have several people who will be presenting items tonight, and so we're going to move around the agenda a little bit just as a courtesy to the people who are here as guests. And so our first item actually does have guests. We have 3 guests with us, Dr. Brian Albrecht from Gateway, Dr. Andy Bill from UW-Madison, David Noyce from Gateway, and William Martin, our Chief Innovation Officer and Smart Cities guru, who will introduce this item. I will just, before you begin, William, can you hear me?
I can.
Excellent. The item before us is the first item on the Finance and Personnel Committee. Alder Taft, could I ask you to please read the first item?
Yes. The first item is item 454-0, communications sponsored by Mayor Mason to enter into a research agreement by and between the University of Wisconsin-Madison and the City of Racine. Recommendation by the Finance and Personnel Committee is that the City Clerk and Mayor be authorized to enter into an agreement between the University of Wisconsin-Madison and the City of Racine. Fiscal note $250,000 as budgeted in account number 70113-57355 Smart Cities.
All right. Would you like to make a motion on this item?
Move to approve.
Excellent. Alder Young, would you like to second this motion?
Second.
Thank you very much. And with that, I'm going to hand it over to Mr. Martin, our CIO, and ask him to introduce our guests, who I'm very excited to have join us today. William?
Thank you, Mayor and President Tate. I just wanted to say just quickly that last year the council approved a resolution supporting the Smart Cities initiatives as a way to increase the city's livability, its equitability, and its sustainability, and lastly, its economic competitiveness. And it's in that vein that we come to you tonight to talk about smart transit and autonomy. And this gives us another option to expand the transportation technology that we use to get us past simply using 40 passenger buses. You're going to talk later tonight about electric buses. This is an extension of that as well in terms of electric vehicles and looking at autonomy research. And there are no greater researchers on this topic than UW-Madison. We have with us Dr. David Noyce, who is the Associate Dean with the College of Engineering at UW-Madison, and Andy Bill, who is the Traffic Safety Engineer Research Program Manager. And in addition, we have Gateway's President, Dr. Brian Albrecht, with us as well. So this project will allow us to spend the city's resources on the capital items, which would be the vehicle itself and some of the accessory materials for that. The balance of the resources would be invested by UW-Madison and by Gateway Technical College, allowing us to have a 2-for-1 match in that process. So Andrea, Bill, if you could begin and introduce Dr. Noyce as well, and if Dr. Albrecht, if you could speak to it sort of in that sequence, then I think we'll make it easiest for the council.
Thank you so much, William, and thank you to the council for letting us speak. I'll turn it over to Dr. David Noyce to kind of give an overview, and I can talk some more details before we turn it over to Dr. Albrecht.
Sure, thanks, Andy. Good evening, everybody, and it's my pleasure to join you here from Madison. My name is David Noyce. I am the Executive Associate Dean of the College of Engineering, and I also lead the Traffic Operations and Safety Lab at the University of Wisconsin. We've been focusing on autonomous transportation for quite a few years now, and some of the technologies that go along with that. And we're really excited to have this opportunity to work with the city of Racine and look at some of the new technologies and how we can assist in expanding those technologies in your city and the region, and find new ways to build on this technology and improve the transit system, not only Racine, but using some of the technologies that will develop from it throughout the region. We're involved both locally and nationally in this area. We're very well connected across the country in the smart city area, and been involved in working with Mayor Mason and others in exploring all these types of things. So I think we can bring a lot to the table and working with you. We're excited about it. We're looking forward to getting down there if you all choose to move forward with this initiative. And we'll be here to help you any way we can along the way. So with that, and that pledge from the College of Engineering, let me turn it back over to Andy, and she can give you some of the details.
Thank you. I'm happy to answer any questions at any point in time. You know, what we're looking forward to is that partnership between Gateway and UW-Madison, the city of Racine, to really bring autonomy to the forefront of understanding how do we educate the next generation in these new vehicles? How do we better understand it? How do we look at it from both a user acceptance and a systems acceptance? How do we make sure that everybody is comfortable with the technology? How do we make sure that it's safe and reliable and that it's meeting our needs? Those are the things that we want to be able to do to be able to answer those questions that William mentioned before in terms of the livability. You know, how do we do first mile, last mile? How do we make sure that we're kind of meeting those spatial mismatch problems to be able to get to that equitability standpoint and that sustainability standpoint? And with all of these technologies, as we're seeing as, the old adage, if you build it, they will come, being able to get this out there and getting some more folks to be able to better understand where the strengths are of the technologies and where do we really need to go is an important component to us. So we are very excited about this partnership and look forward to hearing how we can meet your needs to better improve the city of Racine.
Thank you, Andy, so much. Dr. Albrecht?
Yeah, thank you, Mayor. I just want to say hello to Andy and David. It's good to be a part of this conversation with you, and thank you for taking time to come and share your presence with us, with the council today. And Chairperson Tate, thank you for the leadership in bringing this initiative forward. And I would be remiss if I didn't thank William and, of course, Mayor Corey Mason, who has been the champion in helping us all share a common and broader vision for Racine. It was several months ago where Mayor Mason brought a group together to tour the training facilities at UW-Madison, and it was impressive to say the least. And for the vision to now help bring some of that technology and resource to Racine not only sets us apart for the state of Wisconsin, but I think for the entire nation, and some might even say the entire globe. This will be one of a handful of sites internationally that are doing the type of work, investments in helping create better transportation systems for communities. And Racine is built upon a foundation of innovation, and this just builds on that excitement and enthusiasm. For us at Gateway Technical College, our interest is to make sure that We are in tune with the latest technologies as it relates to all aspects of industry, but in this case, specifically the transportation industry. And as you know better than anyone, that technology is driving all of us to think differently about the types of jobs and careers that are available to our young people. And when I look at this autonomous vehicle program, some people think of cars, and I do as well, and we will certainly have new technologies built into cars. But this includes IT, data analytics, some of the new programs that we have been investing in at Gateway over the last several years, and puts them in a context that can be demonstrated in an urban environment, in a city environment. And I think that's so powerful because it'll help broaden our vision at Gateway for future training needs and give us a chance to interact with professionals at the university on how research can transform not only jobs and careers, but economies for local communities. And the mayor's been helping us better understand that relationship. And with William's work on the Smart City Initiative, I think we're going to be able to build some great opportunities for industry in this area to capitalize on these new investments, and for our students to be better prepared for the job market as it evolves into autonomous vehicle technology. And I might just conclude by saying that the demonstration project is around an automobile, around a car, but autonomous vehicle technology cuts across many different sectors and industries. So some of you are familiar with drone technology. That's an autonomous vehicle technology. The way our ships, the way our trains, the way our airplanes, all of those technologies that we're so familiar with are evolving into an autonomous fashion. So the platform is much bigger than what we might imagine a car could bring to us. But this is a starting point, and it puts Racine right at the front line of that starting point. So I'm excited for the types of career experiences that we can provide to the citizens of Racine. Thank you, Mayor.
Thank you very much. The first question or comment, surprisingly, goes to Alder Young. Alder Young?
Mr. Mayor, and thank you, Mr. Martin and the team from UW-Madison and Gateway. I want to start with a comment, and then I have a couple questions. First is the importance of transportation. You know, Racine is right between Milwaukee and Chicago, in the heart of the third largest economic region in the United States and the 10th largest economic region in the world. Yet we're not really a part of that region because we're the largest city furthest away from an interstate highway system, and we're not connected, is the city of Racine, to either of the two metropolitan areas via rail transit. And so investing in transportation infrastructure, transportation technology to connect workers to jobs and to education is absolutely critical if the city of Racine is going to reach its potential. And so I have a couple questions regarding savings, service, and sustainability. The first is about savings. You know, we have this line item budgeted in the Smart City budget, but I want to really explore, you know, through this type of innovation, what are the savings that local government is going to see as we move forward? That's number one. Number two is service. You know, how are we going to be improving service in a real tangible way, you know, making a difference in the lives of folks who live in our community? And number three is sustainability, speaking to, you know, that green type of infrastructure that exists with this. So those are the three categories that I'd like just some more explanation about regarding this project.
William, I will defer that question to you to attempt to answer, or to open up to any of our three other guests on this topic.
Okay. All right. So I will just start, and certainly I would love for our guests to be able to add. Before I answer that, just quickly, Alder Young, one of the things that we did not talk about is the fact that for the first time ever, there will be an office and a presence of the staff and faculty from UW-Madison College of Engineering in Racine. So this is a major issue, an opportunity. In addition, all the commercialization of these concepts coming out of this research will be commercialized in Racine. So this is one of the reasons why we're bringing this forward. In terms of the savings, right now, the only way that public transit really makes good sense in terms of math is to be able to maximize the number of people on as large a vehicle as possible on set routes. Being able to think about an autonomous program allows us to still maximize those set routes. At the same time, we can save money on more nimble, rapid routes as the economy grows around us, not only internal to the city, but as you say, to the north, south, and west of us, and being able to do those more frequent flyers. We already are responsible for the only transit system in Racine County. This gives us the opportunity to build on that system and be able to connect our rich labor force with opportunities surrounding us. So that's one. Two, it's the opportunity to now think differently about how our housing. Andy Bill mentioned about the mismatch between where housing and our people and jobs are. This gives us a chance to connect that up in a much more rapid way, much more nimbly. You can imagine being able to do on demand. So for folks who, if you think about the sustainability and savings, folks who don't necessarily want to buy a car, but can be able to now have on demand transportation the same way we do on demand food, et cetera. So I think I'll stop there and certainly allow Dr. Albrecht or Dr. Noyes, Andy Bill to be able to add to that.
Dr. Albrecht, Dr. Bill, Dr. Noyes, any of you want to add to those questions from Alder Young?
Yeah, I can just start. I think there's just terrific vision. Trevor, thank you for that, because I think as I look back at Gateways, and I'll just use the automotive program as an example, 15 years ago, automotive diagnostic was not a part of our curriculum. Now Gateway, in partnership with Snap-on, trains all over the world in automotive diagnostics. So when each of us take our car and the first thing a technician does is plug it in and read the data elements to figure out what's wrong with it, this is the next generation of that. So a partnership with the university is going to lead to corporate partnerships to help build sustainable models for new tools, new equipment, new technology, and the use of data science, which is going to expand the economic opportunities for existing companies. And as a result of this particular initiative, you will have a lot of visitors to Racine, and hopefully many of them will stay and invest here as well. So I think that's important. Service is absolutely the essential thing here because you're investing taxpayer dollars, and I completely understand that. From our perspective at Gateway, we're looking at the services. This is an investment in career pathways. We're going to help students understand where those future careers are, give them exposure to that like no one else can in the entire country right here in our home community, and that will lead to them being more marketable in the workplace. So I think that's a good investment for service. And then savings, we always want to try to create efficiencies. I think the fact that it's a partnership is one demonstration of savings. Now, Racine City does not have to make this investment by themselves. They're going to have some of the world's best researchers working on this. That is a good added value. And of course, at Gateway, we're going to leverage our partnerships with our corporations and our facilities. So we intend to use the Racine campus in partnership with the city and the Pershing Park area to help put a demonstration track together, leverage the high performance engine lab on the Racine campus so that we can bring corporations in and teach them also how to build out these new platforms in their city. So I think there's opportunities in each of those categories, whether it's saving, service, or sustainability.
Thank you very much. Andy, did you want to add anything to that?
Yeah, I could. That'd be great. So I think that these are all three important components, and one that ones that we are always striving for. I'll kind of start from the bottom with sustainability. It's really about what type of vehicle can make this happen, and whether it's electric vehicle, low emission vehicles. Those are what we really want to make sure is that we have a good green vehicle out there to be able to use this on, especially if we're doing some more of the low speed or higher speed routes. We need to be able to have some flexibility associated with that and being able to examine it that way. From a service standpoint, we've talked about the spatial mismatch and being able to really tie in our places of resident with our places of business. And we need to look at that. This ties right into some of the savings. And I've been talking with William and others and been doing some research. There's some opportunities out there for grants to be able to study spatial mismatch and be able to better understand how can we redesign or reinvention our transit system to be able to solve those spatial mismatch problems. So that kind of ties back and forth between the service and the savings of being able to examine and understand what's happening there and being able to kind of solve those problems or at least figure out some more innovative solutions for them.
Thank you very much. I will just add, we have amazing partnerships with all of our local universities at the four-year institutions that are in the area. But as a UW-Madison alum, I do have to admit some pride in bringing UW-Madison to have a physical presence here in the city of Racine. So we're very excited to partner with you. Are there other questions or comments from alders? And please virtually raise your hand if you have questions. Okay, if there are no others, I'm going to have the clerk will call the roll. Who are we starting with on this meeting?
Alder Mi'kmaq.
Alder Mi'kmaq is up first for this meeting. Where is he on the list? Here we go.
There you go.
When the clerk calls your name, please vote as you wish. Alder Mi'kmaq?
Aye.
Can we go down the list here?
Sure. Alder Tate.
Aye.
Alderwoman Glenn.
Aye.
Alder Perez.
Aye.
Alder Santiago.
Aye.
Alder Coe.
Aye.
Alder Peterson.
Aye.
Alder Levy.
Aye.
Alder West.
Aye.
Alder Land. Alder Land.
Aye.
Thank you. Alder Horton.
Aye.
Alder Lemke.
Aye.
Alder Jones.
Aye.
Alder Taft.
Aye.
Alder Young.
Aye.
15 ayes, 0 noes.
All right, thank you so much, and thank you to our guests on this. We look so forward to partnering with you on this this year and to come. Moving on to the next, actually not the next item, we're actually going to move around a little bit. We have a number of, well, actually, we will go ahead. We have a guest speaker. I think we can do this mask in a half hour.
Sure.
We think so? All right. We're going to go on next. We have a couple guest speakers that'll be here. We have 2 that are coming at 8, but right now we do have a good chunk of the health department that is here. So I'm going to move ahead to item 477-20 on the bottom of page 18, top of page 19. Alder Tate, if I could ask you to read that item. Sorry to put you on the spot to have you jump ahead there, but if you could read that item, please.
Sure. Item 0477-20, communication sponsored by Mayor Mason, Alder Land, Alder Tate II, Alder Levy, Alder Taft, and Alder Mi'kmaq, requesting to adopt ordinance 0006-20, 2019 novel coronavirus response face coverings. Move to adopt.
Motion to approve the item. Is there a second? We've got everybody muted. If somebody could wave a hand. Alder Taft seconds. With that, I'm going to turn it over to the health department to explain the ordinance that you have before you. Dottie Kay?
Thank you, Mayor. Good evening, Alders. I have Cody Pierce here with me, Cody's the epidemiologist, so if you have any questions about the stats, the numbers, in relationship to the state of Wisconsin and or the city of Racine or county of Racine. Bobby Fergus is also here in the audience. She's the Director of Community Health. If we have any questions about the virus itself, the communicability, the transmissibility of it, she's the one who can answer those questions for us as well tonight. So as we take a look at this ordinance and as we have discussion about it, today was an auspicious day in the state of Wisconsin. Today, they had the most positive cases of coronavirus than they've had in the last 22 weeks that we've been dealing with this virus. So today they had 1,117 individuals that tested positive. We also had 13 individuals who died from the disease today, bringing that total up to 859, and 21% of the cases are active. So again, it was a big day in the state of Wisconsin. The city of Racine is still number 2 if we're looking at cases, and we're looking at within relationship to our 100,000 case rate. As well as the Department of Health Services today released 7 documents that all have to do with face coverings. We are not trying to take away your freedoms. Surgeon General makes urgent mask plea. CDC calls on Americans to wear masks to prevent COVID-19 spread. CDC considerations for wearing cloth mask coverings, including recent studies. How much protection do face masks offer from the Mayo Clinic? Still confused about masks? There's the science behind it. COVID-19 masks, new evidence shows that cloth face coverings slow coronavirus spread. Top health officials have changed their minds about face mask guidance. but for good reasons. Again, all those documents were released today as well concerning respiratory etiquette, specifically the face mask. In addition, Wisconsin passed 40,000 corona cases today, adding 10,000 cases in the last 2 weeks. So across the country, we've seen surges in the virus, and we are seeing that here in the state of Wisconsin as well. As I've already mentioned, 21% of the cases are active. That's up from 18% a few days ago. 10%, only 10% or 10% of the test results came back positive yesterday, but last week it was only 6%. And 49 out of 72 Wisconsin counties are reporting increases in the coronavirus. So if you recall, Wisconsin was one of the last states to get a positive. Racine County was one of the last counties to get a positive, with the city of Racine being one of the last to get the positive. So we can see these surges across the country, and we're seeing that surge capacity starting here in the state, and it's been going on for the last couple of weeks. So when we take a look at masks, you know, increasing, they're going to assist to keep our numbers low. We are limited in our ability to control community spread, which is where we're at, versus travel was where we started. Returning to more restricted, safer Racine conditions would be our only other option. At this point, we are out of tools in the toolbox. The masks are it. A vaccine has not been determined, has not been produced, has not been distributed, and we don't have healthcare treatments available that are appropriate and or fight the disease at the level that we need to fight it. So we're waiting for that vaccine. Returning, again, we don't want to return to it or have more restricted or safer at Racine. If we do not utilize the mask ordinance, our numbers will continue to grow, as we're seeing. Returning to more restrictive conditions would do more economic harm than implementing a mask ordinance. Quality masks are widely available in quantities necessary to sustain a mask ordinance. Large and small businesses have decided to implement similar measures on their own, and we saw that in the newspaper in the Journal Times this week. We would be supporting them by implementing a mask ordinance and assisting in their efforts to maintain a healthy workforce and environment for their customers. Universal mask usage will also allow more freedom for everyone, including those individuals that are at-risk populations, to carry out everyday necessary activities and reduce the spread of the virus. It ensures that our citizens have the opportunity to engage in activities that improve their mental health and overall well-being, minimizing the potential of physical harm that may result from contracting the virus, taking a more historic or holistic approach. A universal mask ordinance will not replace testing, but will assist in keeping the numbers of individuals needing testing lower and serviceable. The other caveat with this, again, we've been dealing this with for 22 weeks, but we also need to be concerned about our essential workers. So our first responders, so our law enforcement, our fire department. We need to make sure that our numbers are low within our hospital system so that they can do what they need to do instead of only focusing on COVID, and our public health to make sure that we've got capacity to reopen and to look at our services comprehensively instead of just COVID. So again, within the framework of the ordinance, the face coverings are for any indoor public place, or I'm sorry, in any indoor public space, in any outdoor public space where 6 feet of distancing cannot be maintained, riding on public transportation or riding in a taxi, private car service, or car sharing. And then we have a section here for B for businesses, for their employees, for their customers, where food is prepared, and when they're in closed rooms. There's also a list of exceptions that we've stated here that we've taken a look at. They're all listed there. So, and we'll be delighted to answer any questions that you've got at this point.
Alder Perez.
Thank you, Your Honor, and thank you, Dottie K, for all the hard work. I have some questions for clarification, please. I understand that there's studies from different groups that conflict with the information, but it does make sense to me personally that if you're going to go out, wear a mask. Distance, it's just common sense approach, and I encourage that. Now, with that being said, I have a couple of questions on the enforcement aspect of this resolution. You know, enforcement is always a critical issue for me, being an enforcement officer myself. Couple of things that came up as I read this. Who enforces this? Who are we authorizing to enforce? I have about 5 questions, by the way. Who are we authorizing to enforce and give citations and track the first, second, or third, or whatever. How is that going to happen? Can you explain that to me first?
Yeah, Alder Perez, I'm going to refer your question actually to the city attorney. They can perhaps answer the municipal court aspect of this, if that's okay, Dottie K.
Oh, sure, please do.
This would, Alderman, for people who are violating the requirements to wear masks or require masks, would be enforced by the police department. The citations written to the municipal court. And then, of course, if there are businesses that fail to comply, then the city, with the due process board, can take action on licensing. Obviously, we hope to never get to those points. You know, I like to believe that people obey the law because it's the law and not because actual enforcement action occurs, but that's what would happen.
Okay.
Next question, Alder Perez?
Yeah, it's following up with the city attorney then. So is it legal then? What would the, here's my concern. Somebody's just going to say, look, I'm sick, I can't wear it. The enforcer's not allowed to ask them what kind of disability or illness do they have, right?
Well, no, that's not necessarily true. This is not a situation, for example, where HIPAA applies. It would be on the person that is accused of violating this ordinance, as with any ordinance, to present a defense that would be considered one of the exceptions.
So, okay, let me ask you another question then. You're an Uber driver and your passenger decides he's not going to wear his mask and we get pulled over. Who gets a ticket? The driver, or the passenger, or how does that work?
Well, the passenger certainly, because there's a provision that says if someone's riding in a ride-sharing vehicle, I mean, that would apply to the driver too, but there's a provision that says businesses, organizations, and so on shall require employees, customers, visitors, members of the public to wear a face mask. That Uber driver is an employee of him or herself, of course, but conducting a business and would be required to wear a mask as well.
Okay. Well, that really doesn't answer it, because I am an Uber driver, and I've had many times told people, hey, you know, you have to wear a mask. I'm wearing a mask, and they don't listen. And I'm not going to leave them off in the middle of wherever we are, because they don't know where they are, and it's unsafe many times. I don't just drive around here. And so I don't think that really answers my question. Why, or does this resolution supersede the emergency powers that were supposed to expire on the 31st of this month, or does this supplement it?
I guess you could analyze it either way, but this, at least as written, is intended to continue through the end of this year, unless the Common Council decides to extend, modify, terminate it, you know, at some other point. But it really is operating in a separate sphere as the emergency powers that the Common Council declared for the city of Racine, or for the emergency declared for the city of Racine. This is an ordinance, a regulation, an ordinance of the city of Racine that regulates behavior, much like the city of Racine has lots and lots of ordinances that regulate behavior. So it's another ordinance that would be passed based upon the statutory and constitutional authority of the Common Council on behalf of the city of Racine.
Well, now that you said the constitutional authority of the city of Racine, I get it. If we pass an ordinance, it has that authority, but is this ordinance specific enough that it won't get challenged and reversed?
Well, I did a lot of research, Alderman. I looked to other places around the country where there had already been some sort of challenges or some sort of review of ordinances beyond just the entity or the city involved. I believe it is. Obviously, we've seen that people can decide to sue us. But again, we have lots of ordinances that regulate behavior. That's what this is, and I think it is specific in its definitions and its prescriptions.
Alder Perez, thank you. That is 5 questions as you listed. There are 6 other people in the queue who would like to speak. I'm going to go to some other folks who have their hands raised. Alder Mietma.
Thank you, Your Honor. Just a couple of questions, and then I may come back to something a little bit later. And I don't know, I'll direct these to you, Mayor, and then you can decide who best to answer these. So there is the section in there, and I know there was some questions asked of me about the persons present in government facilities close to the public. Can you explain and maybe give some examples of what that would entail?
Yeah, I'm going to defer that question to the city attorney as well. But I think other jurisdictions other than ours, but I'll let the city attorney answer.
The assumption is that there are other levels, as the mayor says, other jurisdictions other than the city. There's the county, and there may be other facilities, state facilities in Racine. And for city facilities, the city of Racine has a policy that says anybody that's in a city building has to wear a mask, with some exceptions. When I'm sitting in my own office, I don't have to wear a mask if there's nobody else with me. But if somebody else is with me, I put a mask on. When we're walking through the halls, going wherever we're going, in meetings, we wear masks. So the concern is whether the city of Racine could require Racine County to do something with its facilities, for example, especially if they're closed. But if they're open, this ordinance would require masks be worn by anybody that's in those buildings that are open to the public.
Alder Mietma?
Okay, thank you. So the concept of the length of time, this going till December 31st has been brought up. It was another thing that was brought up to me by several people, and I know, part of the public comments that was brought up in several cases. Can you explain the rationale behind that, and whether there were considerations for alternative deadlines?
Well, we put a date in that would allow the Common Council to debate whether or not that was the correct date, if you will. It makes sense, at least when it was drafted, to go for some substantial period of time. We're talking about approximately 6 months here, but provide an opportunity if it's no longer needed for it to sunset. If all of a sudden there's a vaccine and there's no concerns anymore, the council could decide to end it earlier. But if there continue to be problems, the council could decide to extend it. But at least that's a date that would force the Common Council, if you will, towards the end of the year to think about it and decide whether it would want to have it continue or not.
Yeah. In Alder Mietma, one of the other considerations with that timeline has to do with the schools and the influenza season. So that will be starting. Last year, we were fortunate that we had a break before the COVID started with the influenza. We had a little bit of break and the schools were out and such, but nonetheless, we're concerned about influenza and the timing on that as well.
Just a sidebar on that. When does the influenza season technically start, roughly?
Well, we'd like to see individuals get vaccinated no earlier than the month of October, but we start seeing cases sometimes before that and then obviously after that. It changes a little bit every year.
Okay. One more question, then I'll yield the floor and I can come back up. I know the beach has been another one that's been brought up to me several times. I know that is a pretty popular place these days. I know as a part of this, Part A, Section 2, it does say that outdoor public spaces, what did I say here? Let me look at it real quick. I apologize. In any outdoor public space and within 6 feet of any other person who is not a member of the person's family or household. So does that mean, for instance, for example, the beach, if somebody is able to sit 6 feet or more away, they would not be required to wear a mask?
That is correct.
Okay, I just wanted to clarify just so we kind of are getting a better idea on what all this entails. I will yield the floor for now. Thank you, everybody.
Thank you so much. Next, I will call on Alder Land.
Hello, everybody. I just want to clarify a couple of them. Item 2 on wearing the face covering in any outdoor public space and within 6 feet of any person. I think you mean if within 6 feet of any person. Am I correct?
I think those words in this case would be interchangeable. So if you're in any outdoor space and while in that outdoor space you're within 6 feet, then you'd have to wear a mask.
Alder Land?
I just think that if within 6 feet people is clearer, because it makes it kind of confusing that way. So if we're walking down the street on your sidewalk with your spouse or somebody from your family, you don't have to worry about wearing a mask unless you're within 6 feet, correct?
Yes, correct.
All right. And the other one I wanted to look at is, wait, I got to get my mouse down there. Exclusiveness. Persons, number 9, persons whose religious beliefs prevent them from wearing a face covering. I have been searching all over to find an actual religion that calls it a sin to wear a face mask to prevent a pandemic, and I haven't found any yet. I found faith leaders from Islam, Judaism, Christianity, Catholicism that encourage their members to wear masks. Is there a Mascadist religion? Can anybody tell me what religion would prevent this? I can't find one.
Alder Land, I don't know of any. I'm certainly not an expert in this area, but I would hate to cause a constitutional concern if in fact there were some religion that has that as a requirement.
So anybody could just say then, use that as a reason and just, you wouldn't have to have any backup for it? You could just say it?
Well, certainly they can say it, but if there were to be a citation issued, they would have to demonstrate that fact to the satisfaction of the court.
Okay, thank you.
Thank you, Alder Land. Alder Lemke.
Thank you, Mr. Mayor. So I wanted to highlight again, because I know there are a lot of people watching, a lot of the questions that I've gotten about the face coverings. I think there are exemptions that people should know about. So, for example, people have asked me about children. So, for example, children under the age of 4 aren't required to wear masks. People who, for example, are hearing impaired, where they might need to sign or something like that. People who are actively eating at restaurants, people from your own household and that kind of thing are exemptions from these things. So I think, you know, people have presented me with really reasonable concerns about, you know, what does this mean for me? Does this mean I'm going to have to cover my face, like somebody said, when I'm walking with my spouse? For my 2-year-old, they're not going to keep their mask on, that kind of thing. And, you know, a lot of those things are addressed in the exemption. So I would encourage anyone who has questions. It's posted on Racine Legistar, so you can easily go on and see what exactly the mask ordinance would require. And so I definitely encourage people to do that, because I think people have very legitimate concerns about what does this mean, and kind of how is it going to be enacted, because it could be confusing since we never had something like this happen, and hopefully we won't again. So I would definitely encourage anyone to read that, because I think it's really important. Some of the things that I just wanted to briefly address about why I'm supporting, because I'm going to speak for the resolution briefly. And I did get to ask questions about, the mask mandate and that kind of thing. So I just wanted to draw out a few things from the scientific community. So hopefully people understand more about why we're asking folks to do this, because I know we all, have the best intentions and want to take care of our neighbors and that kind of thing. And you could look at any medical journal or whatnot, but I just picked out a few that are sort of the most read medical journals by medical professionals. One is The Lancet, who came out with an article that said that they looked at 172 studies in 16 countries and 6 continents that were both in healthcare and non-healthcare settings. And it said that using face masks could reduce the risk of infections significantly. And they talked about the various different kinds of masks and what work best. The Oxford Journal of Clinical Infectious Disease, so over 200 scientists who were specifically infectious disease specialists, talked about the fact that they said, a lot of people initially, when the virus was first being talked about, thought that it was spread by droplets. So essentially, if you coughed or if you sneezed and someone, touched a droplet or was very close to you, that you could get infected. But what they're finding out is that actually the virus just lingers in the air. And so these infectious disease specialists said that they've demonstrated beyond reasonable doubt that the virus can be released not only during coughing, but during just exhaling, regular breathing, and talking. And the virus can remain in the air far further than they originally estimated, with the 1 to 2 meters, and actually up to, I believe it says, up to 10 meters, so much larger than a typical room setting indoors. The Journal of American Medical Association's Internal Medicine Journal talked about the fact, some people said, isn't this just like the flu or the cold, which is a really good question. And they talked about the fact in their journal that in the week of April 21st, when COVID wasn't even as prevalent as it is now, that there was a 10 to 44 times greater death rate in COVID-19 than there was in any of the top or the peak rates of influenza season. So it's that much sort of stronger or more virulent. And I think the most important thing is the University of Washington has been the Institute for Health Metrics and Evaluation. Definitely, it's kind of nerdy, but if you're interested, look at it. I think they do a really great job explaining things. And they said on July 3rd that if people would wear cloth or homemade face masks, so whatever, whatever stylish thing you want to make at home or purchase on Etsy, whatever your thing is, it said if people would have near universal face mask or coverings, that we would prevent between 17,000 and 28,000 deaths across the United States between July and October 1st. So in 3 months, essentially, between 18 and 28,000 deaths would be prevented. And so that's like a lot of jargon, but people are coming to me with these reasonable concerns. And I do want folks to know that there are exemptions for all those things that we really care about, like kiddos and people with disabilities, because we really want to respect that. But I think, the bottom line for me was just the last statistic that, if everyone wore face coverings for 3 months, we'd prevent 18 to 28,000 deaths, of our fellow neighbors across the United States. So thank you for indulging me in that.
Alder Lemke, thank you for that information. Alder Peterson.
Yes, thank you. I got it. I guess I have an issue with the fact that we've already passed an ordinance, and I'll read it. I'll read part of it that I feel is pertinent. It says the Common Council grants the Public Health Administrator authority to modify the safer Racine COVID pandemic response standards as necessary to respond to changing COVID-related health conditions. The Public Health Administrator must base modifications and current guidance from the World Health Organization, CDC, prevention, blah, blah, blah. So if this is a question for the city attorney. If the public health administrator did this upon herself, she took this upon herself and made this a mask requirement, is that something that the city would be able to legally enforce, as is written in the present form.
I'll ask the city attorney to respond to your question, Alder Peterson. Attorney Letney?
I think were that to happen, that we would certainly recommend that it be enforced. However, the concern I have is the way the Safer Racine ordinance is written and the way the Safer Racine standards are set forth. They really have to do with, capacities of businesses and operation of businesses, and other facilities and places and schools and things like that. It doesn't really address this kind of thing specifically, and I don't.
I understand that, but it says she can modify the Safer Racine COVID pandemic response standards. She can modify it. It doesn't say she has to stick to any standard. It says she can modify it.
I think the imposition of a mask requirement is beyond what might reasonably be considered a modification of the Safer Racine standards, as opposed to a broadening or a different direction that the mask ordinance would put in place. And frankly, it's much more specific on this particular issue as drafted. And I think it would be clearer, we would be less likely to have an argument as to legality and enforceability if the Common Council specifically were to take action, as opposed to this kind of direction being taken pursuant to 5433B, 4B, I think it is, but the section that you cited.
Correct. So I'm pretty sure this is going to pass, but if it did not pass and Dottie put out a mask mandate, would the city try to enforce it via this statute or not, via this ordinance or not?
Well, I'm always a little weary. I'm always a little weary of giving legal opinions based upon hypotheticals. I'd have to think about that, Alderman. If the Common Council specifically said, we don't want there to be a mask ordinance in the city, it would be difficult to interpret that as meaning that public health administrator can impose one in the face of the Common Council's direction.
I'm stating that we've already given the health administrator that authority.
I understand, and I think that's a reasonable position.
All right. The reason I state this is because in the last meeting, not the last meeting, but when we passed this Safer ordinance, the ordinance to give Dottie this power, even the president of the Common Council stated that this should not be political. That's why we're here. We're passing it, so it's not political. It's in the hands of our health administrator, who will follow the guidances via the World Health Organization, CDC, et cetera, et cetera. So that's where I think it should stand, and I think we're in a place where we're already there. So, thank you very much.
Thank you, Alder Peterson. Alder Tate.
Thank you, Mr. Mayor. I think to Alder Peterson's point, particularly with city attorney's point, is if we wanted this particular activity to be within the scope of the Safer Racine ordinance, then we probably would have to modify what the Safer Racine ordinance is to empower the public health administrator to make this type of particular decision. At this point, that as the city attorney kind of suggested, that this particular action may be beyond the scope of that particular item. So certainly, if an alder or other wants to propose that we broaden the Safer Racine ordinance to include something to the effect of a mask ordinance, that is certainly the option. But we are discussing what is in front of us today. So a few things. First, as a sponsor, I'm obviously in support of this. I think much of the data that is coming out around how do you actually respond effectively to COVID is one, the hammer in the fist of everybody stay home, which just is not sustainable, not economically, not personally, not socially. But the other side is, if you're going to go out and if you're going to engage in people, the best mitigator that we have at this time is masking. And when people talk about responsibility, you know, freedom and responsibility go hand in hand, right? And in order to maintain that freedom, we do have to demonstrate responsibility, not only to ourselves, but to our fellow man, you know, as we are, you know, one nation. So I think it's important that as a city, we also illustrate officially what is the responsible position, that is to, when you're engaging with others, wear a mask. And it's also officially when you're being irresponsible. You know, effectively this ordinance would say, officially, it would be irresponsible to engage with people within 6 feet without wearing a mask in the middle of a pandemic. That's what government's job essentially is to codify and illustrate as a society what we collectively say is responsible and is not responsible, and sometimes require enforcement for that. It would be responsible to drive the speed limit in neighborhoods. It's irresponsible officially not to do so. And when you don't, there is a consequence for that, for your irresponsibility, because you put other people at risk. In a pandemic situation, it is irresponsible to engage with people in large crowds without a mask. And there is a penalty. We are proposing whether there should be a penalty for that. You know, it comes up pretty often, the concept of constitutionality in regarding these particular orders. There's a multitude of settled law in regards to the constitutionality of public health interventions and the ability for local government bodies to set laws regarding the public health. Even Jacobson versus Massachusetts, which is a landmark Supreme Court decision when facing, I believe it was a smallpox outbreak in Massachusetts, literally said, it is upon the principle of self-defense and of paramount necessity that a community has the right to defend itself and protect itself against an epidemic of disease which threatens the safety of its members. We have the duty and the right to protect our community from this epidemic that we're facing called coronavirus COVID-19. That's the Supreme Court, settled law in the early 19th century or early 20th century, and then reaffirmed by our Supreme Court as a 5-4 decision just several months ago. So when we talk about constitutionality, at least know what the constitutionality is regarding the courts and their response of it, and that it's been settled. You know, and then the other piece is, if we're going to debate public policy, we can do that all day. That's what we're supposed to do. And just simply because something potentially implicates constitutionality doesn't mean it violates constitutionality. That means, yes, there could be a question in terms of overreaching a person's rights. There's a question. Doesn't mean it's violation. And then we engage into a public policy debate of, okay, we're proposing masks. What does that look like? What makes sense? What is reasonable? What is unreasonable? And that's a debate we can have all day without having to evoke whether it's constitutional or not. That's just public policy conversation that you're supposed to have. And we should be able to do that, and we can be able to do that. And the question of constitutionality has been answered several times in the Supreme Courts and local courts and federal jurisdictions. So ultimately, this is the right thing to do. I think at this point, I think one of the questions I have, though, particularly to Public Health Administrator Dottie K. Bowersox, is, you know, how does this masking ordinance effectively interact with the safer we're seeing status? And what I'm particularly looking at is, you know, if we apply this, I think the most reasonable thing we could do to kind of demonstrate some semblance of support and trust in our community is to dial back some of those existing restrictions that may exist on certain businesses, because we're saying, you know, people are going to have to wear masks now. Perhaps we could increase capacity at, you know, gathering spaces, event spaces, parks, engagement, because we have this particular intervention in place that does seem to be, you know, one of the 2 pillars of our response to it at this point, between social distancing and masking. So can you speak to that in terms of what you envision, you know, the current status of the safer we're seeing restrictions in place as we, you know, potentially implement a masking ordinance where everybody has to wear them in the various circumstances that are indicated?
Yes, and thank you, Alder. We intend on, for the August 5th meeting, bringing the Safer Racine document and plan back to the council for discussion. We'll be evaluating that, looking at those measurements to make a determination based on the numbers and based on, if this ordinance passes, how can we modify those restrictions? So yes.
Good. I'm glad to hear that, because I think in a lot of people's minds, they're thinking, well, if we're going to have to wear masks, then we should at least be able to, have more of us in a certain space, even though you still got to be spaced out. And I don't think that's an unreasonable position for people to think in their minds, and also expect that the city's recognizing that, certain restrictions, if we apply another one, does that offset some in some way or another? And I'd like to see that occur. One of the other questions I've heard, and perhaps Letney could speak to it or just have a general conversation, but a lot of people have asked, well, wouldn't it make more sense for it to be countywide or statewide, and why isn't that happening? Well, for one part, I agree it should be broader than the city of Racine, but we've heard from our county executive that they have no appetite to impose a mask ordinance countywide. So, call him, I guess. And we've seen from the state Supreme Court that says, the governor and perhaps the public health officer of the state can't do these certain things. So call your legislator. But to the city attorney, could you speak to perhaps the, not legality so much, but the climate in terms of why this might not be happening at other levels of government, and perhaps give some advice to people who live outside the city's boundaries as to what they could do to see this happen in their own municipality?
Well, that's an interesting question, Alderman. Obviously, the Common Council can only deal with its own charge and deal with what's in front of it. But certainly people that don't live in the city of Racine could go to their elected officials or their local health officer and seek some changes. But we can only deal with the city of Racine, so.
Right. And I got a couple calls about why isn't this happening everywhere? It's well, this is partially why. And unfortunately, we can only protect who we can only protect, and who we have the charge to protect is our own citizenry. Back to Alder Meekma's point, he mentioned, or we discussed that this would be, actually a sunset. And I have half a mind to propose that we introduce a review date of 90 days from now, which will be the next council meeting in October 20th, as opposed to just having that simple sunset date out there. Because again, I think to Administrator Bowersock's point, schools will be back in session in some form or fashion, and we'll be entering into the full swing of the flu season. I think it would be appropriate to have a review date as a part of this, as opposed to simply the sunset/review date at the end of the year. And I'll let others go through that, but I think I may be proposing that amendment to the ordinance as it is right now. But first, Director Bowersock, what are your thoughts on, as far as perhaps a midday review or midpoint review, perhaps sometime in October, and how that fits with what you mentioned earlier as far as other health events we expect to be happening during the fall?
Yeah, and that's a consideration, Alder. Again, the date was chosen before the end of the year, the influenza season, as you mentioned, some other items as well. And so to have a report out, I have no issues with that.
Okay. And then just my last question, and this would actually be my fourth, would be if someone could describe enforcement. And what I'm particularly asking is, if someone is engaged with an officer, or an officer engages someone who's not wearing a mask, what is that process, at least ideally, supposed to look like? What will the chief be instructing officers to do in that moment? Because I think folks are curious as to, well, what does that look like? Do we just start slapping fines on people, or is there something before then that we'd like to give folks the benefit of the doubt on?
Well, as with all ordinance enforcement, police officers do have a wide discretion as to whether to take action in one direction or another. Excuse me. Sorry, dry throat. I think the intent and the hope is that police officers will do some education when they're dealing with people, and there's a further hope that the city will have masks available that police officers, and I suppose if folks in the public health department are interacting with citizens, that can provide masks to people so they can be in compliance. I don't really think there's an intent, frankly, to go around writing citations. We want people to protect each other by wearing masks. That's really the intent.
Okay, great. And I just wanted to clarify that because, in my discussions previously, I believe there is the intention that, if someone does happen to be engaged by an officer and they're not wearing a mask, the first goal would be to issue them a mask that officers are carrying, not to issue fines. And I think that's an important piece that people are thinking about, where we're just going to run around slapping tickets on people. The answer is no. the hope is that we can distribute these masks so that people who might not have them can have them and be safe, as opposed to simply penalizing folks. And that concludes my comments. Thank you.
Thank you. Alder Horton.
Thank you, Mr. Mayor. First of all, I'd just like to say that, I think that we're having a healthy discussion. I do think that there are some things that I do have some concern about, and that is centered around, just the citation. We are in a real thick and thin climate as we go, at this time right now. And I think just police interaction with citizens right now, as we are going through some other things, trying to reform some things, that kind of bothers me a little bit. For those people that are out there in the communities that are not informed on the new ordinances, people walking down the street, my gut feeling is that I would hate to see something escalate from a mask ordinance into something more serious. And I've been getting calls ever since 6:30 this morning, and people are concerned that it's not supporting it. I do sit on the Board of Health Committee with Dottie K and the rest of the crew, and I regularly wear my mask, and so do my family. I agree with the mask work. It's just one of the issues is that the enforcement part of how it's enforced, and I would hate for something to turn out as just a simple mask and escalate into something more serious than what we have. So that's my concerns. I think that the conversation that's going on is really healthy. I think that a lot of stuff might need to be fleshed out a little bit more. I apologize for not being at the executive committee, and which it probably was fleshed out. I don't know. So I won't speak on anything that I do not know, but that is a great concern for me at this point.
Thank you, Alder Horton. Alder Coe.
Yeah, a lot of my questions I was going to ask were asked, but I got one. So we got houses in different parts of the city where tons of people just hang out. I want to know how large groups of people being congregated without masks are to be dealt with if there's 30, 40, 50 people.
Dottie K, you want to try to answer that? I don't know.
Yeah, and again, we would go back to law enforcement. That would be a call that they would receive, and that they would interact with those individuals. And again, what we're looking for is an education, as well as being able to make individuals aware of the ordinance, but understanding why we're doing this, not only for the safety of themselves, but also their family and friends and any of the essential workers they might work with.
Well, just a comment and then a couple more questions, but people that are going to wear masks are going to wear them. People that aren't going to wear them don't really care what anybody says, and it's not going to happen. But I got a lot of calls from business owners and also patrons that go to these places. Restaurants and bars are losing businesses to other municipalities. I mean, a lot. Some people called me, well, we're going to go elsewhere. We're not coming back here. But some people that might be in other bars and restaurants in Mount Pleasant, Caledonia, not having any kind of laws in place, they come to our places. I mean, I don't know how wearing a mask is going to control that. And a question for, the city attorney. So say there's 20 people in a bar and none of them are wearing masks because it's hard to drink anything with a mask or eat anything. And if a police officer walks in there, if they're going to cite anybody, can they go after business owners for this?
Well, right. As to that specific example, Alderman, there is an exemption if people are actively engaged in eating or drinking. But the employees that are working would be required to be wearing masks. And if people are, I don't know why someone would be in a bar or a restaurant that's not eating or drinking, maybe to pick up food, to go food or something, those people would be required to wear masks. So, like all enforcement of ordinances, they're situational. And the police officers have to be able to understand those situations, and they deal with them. So, but if there's some other sort of business, if there's, you know, a retail establishment and there's 20 people in there, assuming that's not beyond capacity, all those people would have to be wearing masks. And the business owner would be required to require people to wear masks. A business owner can be cited, if this ordinance passes, a business owner can be cited for failing to require people to wear masks within the business where the ordinance requires it.
Oh, but my question is, if people come into a bar and they're drinking and there's 10 people in there and they're not wearing masks, they're talking and stuff like that, I want to know if a business owner can be cited because they're trying to make some money from their customer.
In that specific example, Alderman, there is not a requirement to wear a mask if you're actively engaged in eating or drinking. So does that mean you take a sip and put a mask on? I don't think that's the intent. But in that particular example, where there are people eating in a restaurant, a business owner would not be cited because the customers are not wearing masks. The employees, the servers, the bartenders, the cooks, they'd all have to be wearing masks. And the business owner could be cited if those employees are not wearing masks. But
okay, I get another question now. I work in a factory. Is it going to be mandatory? It can be 110 degrees in here, and I'm working on machines. Am I going to be mandated to wear a mask because of this? And I am going to be around other people.
I guess it's going to depend on what the safety guidelines are for the particular factory you're working in, because there is an exception if the face covering would create a risk to the person related to their work as determined by local, state, or federal regulations or workplace safety guidelines.
I am concerned about this. I said before I had this thing, so I really concerned about it, but I just think it's kind of unenforceable. I think we need to talk to other municipalities and try to figure out a way to work with them all and have some sort of standard in place that makes this work. I have another individual, a friend of mine, that's almost blind, but he got glasses, but when he's wearing the mask, his glasses get all fogged up and he can't see at all. So if he's walking down the street not wearing a mask, is this person going to be ticketed because he can't see with wearing a mask?
If a person is walking down the street by themselves, they would not be ticketed for not wearing a mask. And I'm afflicted with the foggy glasses syndrome too, and we figure it out.
All right, well, that's all for now. I appreciate it. But like I said,
Alder Glenn.
Oh, thank you. I'm opposed to this, and one of the reasons why I'm really opposed to this is we haven't really heard from the police department on this. Why has the police chief not been involved in any of our meetings regarding this?
You was informed this afternoon.
If
Yeah, the police chief has been informed. I'm not sure why he's not here this evening. I can't answer that question.
Okay. Another question that I do have, I just have a couple. Another one is, as I'm driving down Highway 11, we have two different construction workers working along Highway 11. Are they going to have to wear face masks? Some of them are working on concrete crushing equipment that when we went through all of this once before, that they wear masks and everything else like that. Well, they're not wearing masks now. So are these companies that are working along, all these construction workers in general around the city of Racine that do not are they going to have to be required to wear masks?
Well, the requirement is if you're in an outdoor space and within 6 feet of each other, then you would be required to wear a mask. If they're farther apart than 6 feet, then they would not be required.
And you do not feel like this would slow down their progress. They're doing a great job on Highway 11. I'm not complaining about that. Would that slow down their progress?
I
Because
don't
they're
know,
not
I don't
wearing
imagine
masks
it
and-
would, but again, there is an exception if there is some local, state, or federal regulations or workplace safety guidelines that would prohibit wearing a mask, then they would not be required.
Okay, and just 2 more questions and I will be done. I am and my girlfriend we take turns taking care of each other's munchkins. I am out and about with them a lot, especially walking and riding bikes and stuff like that. Am I going to be fined because they're not my direct family? Is there a possibility that I could be fined for that? I mean, these are really loosey-goosey here, so this is just really hard for me to say.
Yeah, and in Alder, yeah, I understand the question, and at the same point, to go through every single possible scenario and what a police officer would do is very difficult because I'm not them. But again, the whole idea behind this is the education and awareness and looking at the family unit. So if this is if you regularly are watching these children and you trade them back and forth and you're responsible for them and they could be considered part of your unit, then I would say no. But again, it's difficult under the circumstances if you're out there by yourself, you know, you're keeping your 6-foot distancing and such, versus if you're in a crowd.
But that's really not my issue. That's really not my issue. I'm with these kids a lot. And we're out and about walking, doing exercising and stuff like that. Some of them are over the age and some of them are younger than the age. And I know it's informing them, but when you have these kids and one has to wear it and one doesn't have to wear it, I mean, I think it's just really loosey-goosey. I think the police chief should be really involved in all of this, because he's not. So some of these things you're kind of assuming or guessing, and, you know, how can we pass something when we really don't know 100% what is going to happen? The police department has other more important things to be taken care of. You know, we're putting more pressure on them when we have less force out there to help with something like this. I have always been wearing my mask when I go into large places. I've limited myself into places. I've limited the fact where places I can bring my munchkins to and everything else like that. I have a circle of friends that we all do the exact same thing. So we couldn't even get together when we know we're all being safe out there. Quite a few of them are nurses. I will not wear my mask around them every time I see them. I know they do good. I mean, I'm just having such a hard time with this that, and I think the majority of people are feeling the same way that I am. Their circle of friends they can trust and not wear masks around and not worry about COVID-19 or anything else like that. I mean, you know, that's all I got to say. And thanks for not answering most of my questions. Thank you.
Alder Perez.
Thank you, Your Honor. I appreciated a lot of what Alderman Tate said, and I understand it. I think there's again another part to this. I've received several commentaries and phone calls from churches, and they were really concerned about this. They're already limited to the number of people they can have in church, and they're distancing, and they feel that this is just going to destroy their church culture, which on some cases may be a good thing because it will help them get creative, but it's really causing a big burden to them. The other thing I had the privilege of spending a couple of hours downtown on Saturday before the rainfall. And every single place that I went into already had sanitation stations. As soon as you walked through the door, you could get a mask, you could get Purell or whatever it was to sanitizer to clean your hands with. They had shields and where you pay. And I was really impressed because I know that they didn't have to do it, but they did it because their business is important to them. If we make this mandatory, I think it's just going to put a lot more pressure on the businesses. And I already got a couple of personal emails that said they're not, people are not going to shop in our town. They're going to go elsewhere. I get it that it's a health issue, but it's also an economic issue. And we're burdening our business community extraordinarily. I get the part about the laws and I get the part about saving lives and I get that. But if you mandate this, I think it's taking away from the people's personal responsibilities. The business owners are going to do whatever they can to maintain people coming into their business. So it means that they have to set up 10 sanitation stations. They're going to do that. So mandating them to do something specifically is going to be a bigger issue. Also with restaurants, I got several phone calls from restaurant owners within the city saying that they're just going to have to shut down. After reading these guidelines, it's just going to make them almost impossible. People are not going to want to come into the city to go to any of these places because of these things. They have many other options. I think if we make it mandatory, it's problematic. I think if we make it voluntary, strongly voluntary, it's going to be an issue. We look at what's recently been happening in our community. Police officers are chasing shooters on the beach. Unfortunate for us as a community. I don't really think they're going to want to nor have time on their hands because of their scheduling and so forth to go after people who are not wearing their mask, even if it's for educational purposes. I think Alderman Glenn made a good point. The police department should be here, but with all the things they have going on, the shortage of staff, some of the other issues that have come up, I'm troubled by the fact that we're going to depend on the health department to issue a violation in a business or the police department to give someone a ticket. They're not going to have time to do any of this. And I'm wondering if, I get it, as Alderman Tate said, the rules, the laws help us control what we do as a society. I understand that. I understand that critically. But I also think that we're going too far. We're going too far mandating it. Like I said at the beginning of my first commentary, I go out, I put my mask on. I understand it. I get it. People are compromised, immunocompromised, it can spread. I don't have to do it. I do it because I feel it's necessary. And I think a lot of us have to take a lot more personal responsibility. If we break the law, we break the law. But we make the choice to obey the law. And something like wearing a face mask is really something that we should really try to do, not mandate it. We need to think of other people. I get that. And I agree. We should be thinking about other people's, it's a biblical principle. Think about other people for yourself. But mandating it, I believe, is wrong. Make it voluntary. It's really not going to be enforceable. I see the guidelines, and I know we have to make an effort to do something, but I think it's hurting us economically. It's hurting us, the morale of our community. And when people have to go outside of our community to get their needs met, it really hurts us overall. We're not going to be able to move forward as a community, build our downtown. We're developing a smart city. Nobody's going to come here. Nobody's going to be able to ride those buses we just talked about. I mean, come on, think about this. There has to be a balance. And yes, guidelines, awesome. Let's strongly encourage people to follow them. If we mandate them, I believe we're making a mistake. Thank you.
Thank you, Alder Perez. Alder Young for the first time.
Yes, thank you, Mr. Mayor. So I want to respond to a couple of things that Alder Perez pointed out, because I think too often we have these discussions and they seem to be one-dimensional and they don't look at the entire picture. And, we've had a great discussion about the legality of this. Alderman Tate highlighted the constitutionality of this type of issue. We've had amazing contributions from Alder Lemke and Director Bowersox about public health. But we haven't really talked about the economic perspective as much in terms of the benefit of having this type of requirement. So just like science, economics also is led by data in many respects. And so there's an institute called the Longwood International, which does traveler studies for convention visitors bureaus across the country. And they do studies regarding consumer attitudes. And they just released a study Tuesday, July 21st, that indicated that travelers' attitudes, that people are 60% more likely to prefer a destination that requires masks, and that 35% of those surveyed said that they will only visit destinations that have these mask requirements. This is a global health pandemic, and we need to do our part not only to acknowledge the public health aspect, but understand that consumers are going to be making decisions about where they are going to spend their money and where they feel safe. And so I view this as just as much as an economic strategy during this difficult time as a public health strategy. And we see study after study from consumer reports that showcase that this is not just a good public policy to keep people safe. It's a good public policy to make sure that people feel like they can spend their money in this community. So anecdotal, conversations are important in terms of hearing stories and that quantitative, understanding of the economy locally. But we already have data about consumer trends and what people expect. And I think that this puts Racine at an advantage when you look at the data around, what consumers are demanding for their public safety. And so, I support this just because it makes sense in terms of public health. It makes sense in terms of the economic impact. All of the examples that were provided from alders asking questions about, well, what about this? What about that in terms of the mask ordinance are spelled out pretty explicitly in the exemptions. And, as was previously discussed, we are well within our legal bounds to be able to protect people and keep people safe, as illustrated by the Supreme Court's most recent decision, the United States Supreme Court. So I support this, and I hope my colleagues will do the same. Thank you.
Thank you, Alder Young. Alder Taft.
Well, I think I was going to speak to a lot of what Alder Young said and Alder Lemke said. So thank you for that. I just wanted to speak in favor of this. I mean, it's a minor inconvenience for the vast majority of people to wear a mask. There's a lot of, there's a lot of variation in masks. There's a lot of different ones you can try. I have asthma personally. I understand the difficulty, and I think our exemptions spell out that legitimate medical concerns will be exempt. I think we've covered all of our bases, and fundamentally this is about keeping not just ourselves but other people safe. So when I go out, I wear a mask, not so much for myself, but protect other people in case I'm asymptomatic. I mean, this is something that shouldn't necessarily have to be mandated, but unfortunately this issue has been very politicized, and so we are at a place where we need to mandate this to keep everybody safe. And I think this is entirely data-based. This is entirely resulted from the numbers in our state and in our community, and I fully support this mask ordinance, and I appreciate everybody's good discussion today.
Thank you. Alder Land.
Yes, I would like to start out, well, I am in support of this also, and I'm going to tell you why. I'm going to start out with some stats about states that have tamed the coronavirus after reopening. They're all out east: Connecticut, New York, Massachusetts, New Jersey, and Vermont. In Connecticut, they went from a weekly average deaths of 113 on April 26 to 5 on July 2nd. Connecticut mandated masks on April 20th. Massachusetts, from April 15th to July 14th, their hospitalizations have dropped by 84% after a mask mandate on May 6th. New Jersey, the highest rate per capita deaths, 175 per 100,000. They now have a positive rate of 1.3. It was the first state to issue a mask mandate on April 8th. Those are just some stats about the states that are successful in taming this. And also, I did receive a lot of communications from people in my own district. I had 8 people in favor and 3 against. Now, when this virus first started, I used to think of how many people I knew that had it. Since then, I've lost count of how many people that I know that had it. I now know 3 people that have died from it. And I had a very close person to me who was in the hospital, seriously ill, young, healthy person. And she has recovered now, but I don't understand why people, it's not a big deal to wear a mask. If you can just save one person from going through what my friend that was in the hospital had to go through, or for the ones that died. If you can just save one person from that by just putting a mask on, what's the big deal? I don't understand it. And people have compared it to the flu. Well, I'm 63 years old and I don't know anyone that died from the flu, thank God. But I already know 3 people who died from this virus in a short span of 4 months. And also, it can also get into your system and do damage to your organs. It doesn't go away from everybody like the flu does. It does damage. Yes, it's inconvenient. Yes, my glasses steam up. But I did read, as far as what Alder Young said about economics, if masks are out there, I feel safer going out and supporting businesses. I've been getting food to go because I wanted to support businesses, but I would feel more comfortable going inside if I knew that people would be following this ordinance. So I am in support of this ordinance. Thank you very much.
Thank you, Alder Land. Alder Glenn.
I didn't have my hand raised up again, but I do, really want to reiterate, I am with Alderman Perez about, what he says about the business and everything. The many emails that I have gotten have stated that they're going to go elsewhere. And especially for downtown Racine, we need, and other small businesses here in town. I think it's really going to hurt them, and we just need to slow that right now up a little bit. I am not mandated to wear a mask, but I do wear a mask. And I think most people are truly like that they will wear a mask when they are going up to be amongst large number of people, large crowds and everything else like that. I wear my mask for my grandsons, and if you cannot see them bouncing in and out of this meeting, they're most important to me. And if that's who I do it for. And if more people do feel, I know more people still do feel the way that I feel, that they are going to continue to wear a mask. We don't need to be mandated to do anything like that. We're going to continue to do it. The numbers out there, I don't believe in all the numbers that are being printed are correct. I think it's going to come back in the end is to show that the numbers aren't as high as people state them to be. There's many of things out there saying that they've tested, blank tests have gone in and it has come back positive. I think this is something that we need to feel take responsibility for it for ourselves. Otherwise, this just isn't gonna go right.
Alder, thank you very much, Alder Glenn. Alder Mi'kmaq.
Thank you, Your Honor. Couple of quick questions and then just a few comments. So it was brought to my attention by a professional in the mental health care field that they expressed concerns over there being a piece of this that identifies mental health conditions as a reason for not having to wear a mask. Part of the arguments behind that were that they were worried that there was going to be people trying to self-diagnose themselves with mental health conditions in order to justify not having to wear a mask, and putting either excess burden on their mental health services that are out there, or devaluing the true burden that mental health conditions put on the people that are truly suffering from these. And it was recommended that maybe we want to look at considering, or could we consider including in there something that is connected to a doctor's recommendation that they are excused from wearing a mask. I want to make sure that we are supporting those that are providing services beyond just COVID-19 relief, and supporting those people that are doing things that are very important to people that need it. And we're not devaluing efforts that people are putting forth around some of these things, especially mental health and situations like that. So Director Bowersox, I don't know if you can speak to that, if you have heard more. I know this is a recommendation for the Center of Disease Control guidance, or based on their guidance, but it was brought to my attention, so I thought I would bring it up.
Yeah. Oh, thank you, Alder. Getting a doctor's slip or getting some sort of slip from a medical professional or mental health professional saying that you do or do not, I think would put in an additional burden on individuals. So again, it's the self-disclosure to whomever you're having conversation with, and I can only imagine that the mental health providers have probably been as overwhelmed as what we have been, as well as other practitioners with questions. Hopefully that would not be the case, but I wouldn't recommend getting a notice or a letter from a doctor or a practitioner on the condition. It seems like that, again, would be an additional burden.
Okay. Yeah, I understand that. That makes sense. And the only other question I have is, there's been a lot of people reaching out with concerns about their business, whether it's, fitness centers or, other businesses that are kind of unique in the services that they provide. Are you, and I know you are, but I just want to, again, clarify for people's understanding, you're available if businesses are concerned about how they can make adaptations, and so people would be able to reach out to you to talk to you about adaptations they would be able to make to stay viable as a business. Is that correct?
Yes, and they have been for the entire time. That would be correct.
Excellent. And what is the best way for people to get a hold of you, just so we can share that with the community that is watching?
Oh, they can call the health department directly. Our 636-9201 number would be a great start. They can leave a message. They can talk to someone. We can get them hooked up with the right person depending on what their circumstances are to answer their questions.
Wonderful. Thank you for that. So clearly I'm in support of this because I'm a co-sponsor for this this proposal, this ordinance. I had a written thing because I wanted to keep my thoughts in order, but I think a lot of what I was going to say was covered by many of the other alders. I really appreciate the comments by Alderman Tate II about dialing things back, and I think we're looking at this situation in kind of a disjointed way as far as how some of the alders are presenting this information, and I think Alder Tate was kind of getting to that point. We're going to get a lot of feedback from people in the community, and we're going to get a lot of doomsday scenarios, or we're going to get a lot of praise, or we're going to get a lot of people that are very skeptical, and people are all over the board. People are dealing with this in a variety of different ways. I talked about the mental health piece. It's clearly having an impact on people in that capacity. This sucks. This totally sucks. And it is not an easy thing for us to make a decision about in any step of the way. And if you follow the path we've been on, we've been trying to do the best that we could with what we've had. And as we're looking at this mask ordinance as a logical next step, it is my hope that we're looking at that in the vein of being able to continue to scale back the Safer Racine to ideally ultimately being able to limit it. I would much rather be looking at a mask ordinance than having to shut things back down, which I truly hope never has to happen. I think that this is a much more reasonable compromise. I say something to my son all the time. I say my number one job is to keep you safe. And now I know parenting is different than, being an alderman or an alder person, but that sentiment itself is, I think, relevant here. We need to be doing the best things to keep the residents of our community safe. Alderwoman Glenn said that that's the reason she wears masks, because of her grandkids, and those are her motivation for making that choice. But we also know that there's a lot of people out there that aren't going to make that choice, and it sucks that we are in this position that we have to create an ordinance to help them make that choice. But that's the reality that we're faced with. And we can run in fear that people are threatening us that they're going to not come and do business, or they're not going to do this, or they're going to start doing that. But that's not how we should be making our decisions today. Because I believe that most of the good people of this community are going to try and continue to give their business to the businesses of Racine. I believe that people want us to succeed and are willing to make compromises. Alderman Perez had said that he thinks it's a good thing that churches have to try and adapt a little bit. Well, I think that's the same for businesses too. I think it's a good thing that businesses try and adapt and evolve to find ways to succeed and survive during this pandemic. And it's up to us to put all those other pieces aside and make the decisions that are in the best interest in the health and well-being of our community members. It's up to us to do the next right thing. And I think this is it. I think that the data is there. I think that the support is there, because if you look at the public comments that we were sent, it was split 50-50. There were just as many people that were in support of this and wanted to see this come to fruition as there were people that were concerned about it. And I think that speaks volumes too, that it's not everybody in the community doesn't want this. That's not the case. I think this is a very clear thing. If you look at other municipalities that have implemented these, there's some pretty strict versions of this out there, and ours is not that. We're being pretty fair if you go through and look at how this compares to Madison, for example. We're giving people a lot of leeway and a lot of ability to find ways to succeed within this ordinance. So I hope that all of you are willing to do the next right thing and give this an opportunity to be the shield that we put up for our community to try and stop this. I hope other municipalities that surround us listen and think about what's best for the citizens and community members that they have to represent. This is our opportunity to continue to try and do the best we can to keep the members of our community safe. And I appreciate everybody who's willing to do that with me today. And I hope that we are able to see the end of this pandemic by doing these right things along the way. Thank you.
Thank you, Alder Miedema. Alder Coe.
Yeah, I just got a question. So when I was speaking about the eyeglass thing, I have a friend of mine that's legally blind. And having a mask on, he has to wear glasses, but having a mask on, really messes with his sight. And my worry is, can this person get a ticket, or can they get something from a doctor that excludes them from this?
Okay.
Yeah, and again, Alder, the extra step to involve a practitioner, whether they be a mental health practitioner or a physical practitioner, to get that notice. Number one, I'm not sure, how you go about that. I've never asked for that. But at the same point, self-disclosure is very important. So if it states in here for the exceptions, if they have a disability, that they're excluded from having to wear the mask. So again, a self-disclosure if they were interacting with the police department.
All right, it's just my friend had a concern about this, and I wanted.
Sure, understandable. Yep, understandable.
All right, then. Thank you.
Thank you, Alder Coe. Alder Tate.
Thank you, Mr. Mayor. Just one more comment, or actually it's regarding exemptions on face coverings Part V. I saw a particular question about photo studios, and I think as this reads, persons who are obtaining a service involving nose, mouth, or face for which a temporary removal of the face covering is necessary to perform the service, I imagine this would also qualify as taking family portraits, for example, would be exempt from that time. Is that an accurate interpretation?
Yes, that would be correct.
All right, thank you. And just the last comment I'll make is, I get the sense that people want the choice. And the reality is a law being in place doesn't preclude choice. A law being in place just introduces a consequence. So anybody who doesn't want to wear a mask, you still have every right not to wear a mask. There are just simply consequences associated with that. Just like if you want to drive without a seatbelt, that's your call, but there's a consequence for that. If you want to drive on the wrong side of the road, that's your call, but there's consequences for that. And it's consequences because it affects ultimately the public safety and the public health. That's why it exists. So, people who want to have the choice is still there, still entirely free to do what you like. Now there's just legal consequences behind whether you make an unhealthy, unsafe choice. And I think it's important to kind of illustrate that, regardless of what the laws may say, regardless of what the ordinances are, people still have a choice as to whether they comply with those or not. Now you get to deal with the consequences of that choice, but that's the reality. And I think it's overlooked sometimes, where people feel like they're being forced to do something, when part of the reality might be, when there's a law, most people are just going to follow it. And you might not want a law to be in place because you don't want to have to follow that, but ultimately, we're generally law-abiding folks. So if there are laws, that's what we follow. Similar to Florida. When we saw those kids down there at the early onset of COVID, their response wasn't, we're not going to the beach because it's not safe. We're going to the beach because they can't, they're not saying that we can't. That's the biggest difference. But once they were told you can't go to the beach, and they're like, fine, we won't go to the beach. But that's the difference. So sometimes it's just necessary to say, like, you should not do this thing, or you should do this thing. And then people will generally comply, because we mostly want to be law-abiding citizens. And sometimes we have to introduce a law so that folks know this is the right thing to do. And you could choose to do it whether the law was there or not, but since it's there, there was to be a consequence if you don't. And that's just sometimes what's necessary, particularly in crisis situations such as a pandemic. So thank you.
Thank you, Alder Tate. Alder Santiago for the first time.
Yes, thank you, Mayor. Don't have a lot of questions, or really any questions. I was going to ask about the effectiveness of a homemade mask, because I do have some concerns that a lot of citizens aren't going to be able to afford a store-bought mask. I don't want to be facetious. Obviously, you know, we want people covering their mouth and their nose in any case. So I don't want to go down that. We don't have to go down that road. I would just like to say, you know, I want to acknowledge, I have a lot of business owner friends, and a lot of people are afraid of the uncertainties that this poses. And like Alder Horton expressed, I am a little concerned. In my district here, we have some high poverty areas, and people in high poverty areas tend to have more crowded households and are less likely to have things like air conditioning or central air, which forces people out in, you know, small crowds in front of houses. And, you know, my concern is that there's no clear specifications of enforcement here. It's really kind of up in the air, and it's at the discretion of the police in each individual case. And I think that that's inevitably going to lead to inconsistencies of enforcement. And like Alder Horton was saying, I hope that that doesn't lead to more serious interactions or consequences. You know, that's just what's been on my mind. Obviously, we need to protect our citizens, and we need to slow the spread. And, you know, like Mikimo was saying, I wish everybody was responsible enough to just wear the mask. You know, it's a really hard vote tonight, and it's a really, you know, we're in unprecedented times. But I did just want to say that I'm not too crazy about the uncertainty of enforcement. I wish we did have Chief Howell here to explain how things would be enforced, and, you know, before making a decision. I understand he's not here, and that's not possible now. But I don't really have any questions. I just wanted to express that and let people that have reached out know that, you know, they've been heard, and I was at least able to express that here in the meeting. Thank you.
Thank you very much, Alder Santiago. Alder Lemke.
Thank you, Mr. Mayor. So I very much, I have to say, I appreciate all of the angles and conversation the other alders are bringing up. I appreciate the tourism data. That was not something I had, and I'm nerdy by nature, so I appreciate that, Alder Young. I think two brief points, because I don't want to reiterate. I really appreciate Alder Tate's point about looking at things comprehensively. I think when we enacted Safer Racine, there was no mask related laws, and so if there is a way to loosen restrictions now that there are mask related laws, I think that would be like a great sort of give and take, so that we can make things easier in some ways for folks. And then another thing I'll say is, you know, I am concerned about when I hear about you know, people patronizing our businesses. So it was great to hear that, like I said, the tourism data, please forgive me, from Alder Young. But I'll say, I think that there's an opposite side of people wanting to shop at businesses where they feel like they will be safe. You know, just an example from my personal life, I have a friend who had breast cancer, you know, thought she'd beat it. She has now cancer of the blood instead, and God help her, 30 days ago, she had to have a bone marrow transplant and go through all of that, which is normally high risk in this environment. So I honestly don't know how she's doing it. And, you know, I'm seeing her, just like everybody else, post on Facebook what they're up to, what they're doing. And, you know, frequently she says, well, I don't feel like I can go in XYZ place because, you know, people are always there, you know, masks hanging off. And she feels as like a person with cancer who just had, you know, if full, you know, all these transfusions and whatnot, and that she has to go remind people, hey, there are people here who might not have the same situation as you. Could you please just back up 5 feet or whatever the thing is? And I do think there are plenty of people who are in those situations where they're elder. I mean, we have an older community as well. There's no doubt about that. So, you know, you're looking at elders, you're looking at people like my friend who have, you know, who's immune compromised, and, you know, maybe you can tell by seeing her, maybe you can't. But I think that those folks and like our elders and whatnot want to shop at places where they feel like they're not going to be putting themselves in danger because they go to XYZ place. So I think that, you know, there are also people who will come because of those factors as well.
All right, thank you very much. Are there other? Alder Santiago, you have your hand up. I do hear the request that you made about, no? Still up? All right. That exhausts, Alder Meekman, you've spoken twice. Is there a clarifying thing that you need here, or?
I want to propose an amendment, please.
Okay, that would be appropriate at this time.
So, or I would yield to Alderman Tate II if he would prefer to do it, since it was going to be his amendment originally.
Alder.
All right, I'll go ahead and do it then.
Okay.
I would propose to amend the length of this to be revisited on October 20th, the council meeting on the date of October 20th for an update on this and a possible reconsideration by the council.
Second.
Okay. So I'm going to ask the city attorney to reiterate that, just so we have clarity on what it would mean. So we would add, just so I'm clear on it, we would say that the sunset on it would still be end of the year, but we would revisit it at October 20th with a report or an update from Dottie K. Bowersox and possible reconsideration by the council. Does that describe your language, Alder Meekman?
Yes, thank you, sir.
Does that make sense?
Yeah, so there's a similar provision in the Safer Racine, and maybe we can amend this to say October 20th, but the Safer Racine ordinance says no later than August 5th, 2020, the public health administrator shall provide a full report to the Common Council regarding the state of COVID-19 pandemic in the city of Racine, and the Common Council shall take action to extend, modify, or terminate the application of the Safer Racine upon receipt of the public health administrator's report. Do you want something similar to that, with those options available to the council to be available on October 20th? Or do you
I
just
think that
want
would
the
make
report?
sense.
Okay, so if I draft language that essentially is the same as what's in the Safer Racine, but change it to October 20th as relates to this mask ordinance, that's what you're looking for?
Yes, sir. That would be adequate.
Okay.
Okay. Does anybody want to speak to Alder Meekman's amendment? Alder Tate?
Yep, obviously in support of this, but I think I just want to make sure that it's clear that we still want the sunset provision to remain in effect as it currently is, but also to add this additional checkpoint, if you would, to review where we're at, how things are responding, what the numbers are, to determine the actual existing necessity of this particular ordinance. So certainly in support, and I think it is important that we continue to provide regular and intermittent oversight over kind of these extraordinary conditions and steps that we're taking to try and keep our community safe. Thank you.
Thank you, Alder Tate. Our checkpoint's a good metaphor for that. Any further discussion? Seeing none, the clerk will, I will open the roll. Please vote when the clerk calls your name as you wish.
Alder Miedema?
Aye.
On the amendment.
Alder Tate?
Aye.
Alderwoman Glenn?
Aye.
Alder Santiago?
No.
Alder Perez?
Aye.
Alder Poe?
We voted,
On the amendment to the October 20th Common Council meeting for a possible reconsideration. Did I state that correctly, Attorney Latley?
all right, I just wanted to make sure it was for the amendment, yes.
Alder Peterson?
Yes.
Alder Levy?
Yes.
Alder West?
Yes.
Alder Land?
Aye.
Alder Horton?
Aye.
Alder Lemke?
Aye.
Alder Jones?
Aye.
Alder Taft?
Aye.
Alder Young?
Aye. Aye.
That's 14 ayes, 1 no.
I'm sorry. Can we let the record show that I meant yes? I'm sorry.
So that's okay. So it's going to be 15 yeses.
Yeah, without objection, we will change or clarify that Alder Santiago's vote on the amendment was yes. Okay. We now have the item before us with no other discussion. Let's see if there's... Chief Howell was trying to call in. I just want to see.
Oh, Chief Howell?
Yeah.
Everyone has to call.
Hang on just a second, everyone.
Howell's on the line.
Chief Howell, are you on the line?
Yes, I am on the line. I can hear you all.
Okay. So there's some questions about enforcement that Alder Santiago and other alders raised about, whether or not this would be a vehicle to have lots of people cited. And I know you've talked about this in other settings around safety and other things about the approach generally the State Department takes to first educate and encourage people to comply with these sorts of things, as opposed, and, under the spirit of the community-oriented policing approach to things. But can you just talk about what the approach would be for a municipal citation with a $25 fine?
Can you mute us again?
The COVID.
Right. Those.
I know. You're gonna knock everything out of it. Just let them try it. Just let them try it.
Can people mute themselves, please?
I'm trying to mute everybody. Art, can you still hear
Quite a few people.
us? Yeah. Art, are you still there?
Yeah, it sounds a little more quiet now with everybody muted.
Okay, great.
Oh my God. You are not a
He said he can get it over the stove like somebody else.
Yeah,
Alder, are you there?
crazy. Okay.
Chief Howell, are you there?
Yes, I'm still here. Yes.
Okay, so I don't know if you could hear the question that we had before, but there was,
I'm gonna cook for you good this week, I promise.
Yeah. We hear that all the time.
Hey, you gonna cook for me? 5?
Yeah. 17. Alder Howell, or Chief Howell, are you there?
Yeah, I'm still here.
There we go. We narrowed down. You are caller 17. I apologize. Your name was not identified, so we had to do that through a process of elimination. So sorry, there were several alders who asked, just sort of with the $25 municipal fine around mask wearing, the concern about what enforcement was going to look like if the police department had plans to run around and write a lot of tickets. What I was asking if you could clarify just the approach that the police department always takes around compliance and education as first steps before some of these other matters come into play. So I'd ask you to speak to that generally, and then there's at least 2 alders, maybe 3, who wanted to ask you specifically about what the department's approach might be on a $25 municipal fine for for not wearing a mask under one of the qualified exemptions for not wearing a mask.
Yeah, so more broadly, some people know this, some people do not. However, when the governor first issued the Safer at Home order, that was perceived by some to be a license for police officers to go out and basically randomly, arrest people or cite people. Nothing further from the truth could have been the case. I can assure you that, and many of you know this from your emails to me, between our normal daily activities and responding to calls for service, mitigating conflict, addressing speeding concerns, things of that nature, we don't necessarily have the resources to all of a sudden switch all of our attention to the Safer at Home issue. Obviously, if there's a situation like we had in the area of 11th and Villa, where you had literally 100 people congregating, not only violating social distancing, but basically causing a major disturbance in the neighborhood, that was the exception to the rule. That's when we actually do take a no-tolerance approach, and it's for a couple different reasons. It's to bring stability to the neighborhood, and it's to prevent the spread of COVID-19. And so from that context, when the original order was put in place, there was actually one business throughout that whole time that received a citation, and 25 other folks initially that were involved in this order. Now, fast forward to the mask ordinance, if in fact that's what the council decides is appropriate for the community to slow the spread of COVID-19. Certainly, if there are extenuating factors that would require police enforcement, we would look at that on a case-by-case basis. But our general approach from a community policing perspective, we had through the generosity of S.C. Johnson and Malicki's Piggly Wiggly, we did a food drive at the outset of the COVID-19 crisis. And the first thing we did is we made masks available at the COP house, that houses where we distributed the food. And so from a public safety perspective, I mean, we always seek to gain compliance whenever there's a new ordinance that's in place. And so we literally have thousands of masks that were ordered, and we plan to have those masks available not only at certain COP offices when we're able to distribute there, we will have masks available in our squad cars as well. So if you have indigent people, elderly, or anyone else that's at risk that needs protection, the goal is to basically keep the community safe, not to impose another fee on the community. So hopefully that answers the general perspective on this.
Okay, Chief, thank you very much. I think that's generally speaking along the lines of the questions people were asking, but if people have specific questions for the Chief, now's your chance to virtually raise your hand and I can call on you to pose your question. I think you hit all the high points of what people were asking for. Chief, thanks very much for making yourself available and doing that.
No worries. Thank you.
Thank you. Seeing no other discussion on this, the clerk's going to call the roll. When she calls your name, please vote as you wish. Alder
Mikma?
Yes.
Alder Tate?
Yes.
Alderwoman Glenn?
No.
Alder Santiago?
No.
Alder Perez?
No.
Alder Mikma? Oh, apologies. Alder Coe?
No.
Alder Peterson?
No.
Alder Levy?
Yes.
Alder West?
Yes.
Alder Land?
Yes.
Alder Horton?
No.
Alder Lemke?
Yes.
Alder Jones?
No.
Alder Taft,
Yes.
Alder Young,
Aye.
that is 8 ayes, 7 noes.
The motion carries. We're going to take just a 30-second breather here to set up for the next item. If people want to take a quick bathroom break, we'll stand informal for just 2 minutes.
Thank you, Scott.
Christopher, are you there?
Yes.
All right.
Can you hear me okay?
Yep. I think we're just waiting for Allison to get on.
All right, great. And then should I share my screen or do you want to go through the PowerPoint there?
No, we've got your PDF of it, so we'll need you to tell us when to advance the screen, but we've got it queued up. Give us just a second. If you could try to reach out to Allison, that would be great. So she's anywhere near her phone.
Some of the slides have some animation. There's no way to share the screen, or is it just PDF? PDF will be fine if need be.
Can you email us the PowerPoint then, so we're not using the PDF?
Oh, I did. It should be the link you saw there. Or it should have been the email.
Let me look. Hang on.
PDF's fine. It's only like 2 slides with a few things, but we'll wait while Allison is coming in here. Find the panelist. Okay.
Christopher, can you try and share your screen?
Trying to do. Oh, I should also. Let's see here. Share content. It looks like it's not activated. You may have to activate the option.
Pass it around real quick.
Yep. Give us just a sec here.
You have to activate.
All right, Christopher, try it now. You can...
Perfect. Great. I think it says share file. Let's see. Share. Am I on camera? Okay. It just lets me share a file. Doesn't look like. Hold on. Let me try. Share content. You may have to run it from there. There's no way to.
We're making you a presenter. Let's see if this works. Hang on just a second.
Oh, great. I think that did it actually.
If you go up to share, you have an option to choose, application doesn't come up anymore. I believe because you're the presenter. There should be a share application, and then you should be able to select the program you're using. There we go.
Great. Okay, everyone can see my screen. Great. And you can hear me okay?
Yep. All right, we need to resume the meeting then. And we're going to begin recording. I'll introduce you in just a second here. You ready?
I believe you're ready.
All right, everyone, we're back. I apologize for the delay. We're going to move ahead on your agenda to an item where we have other folks waiting to participate. If people could move to page 19. Alder Tate, if you could read item 04740-20.
Item 0474-20, communication sponsored by Mayor Mason submitting city business action taken pursuant to COVID-19 emergency declaration for consideration. Recommendations that Common Council ratify Mayor Mason's proclamation as set forth below. Agreements for the Cornell Medical College of Wisconsin City of Racine COVID study as attached.
All right. Alder Taft, is there a second?
Yes.
Move to adopt.
Second.
All right, thank you very much. So it is my pleasure to introduce two guests who, this is actually now the third and fourth institution of higher education that we're talking about partnering with in this meeting, but I am pleased to introduce Dr. Christopher Mason, who is a genetics professor at Cornell Med School, and my brother, and Dr. Allison Kriegel of the Medical College of Wisconsin, who is a Racine native. I'll introduce this very briefly and let the two scientists take it over because they're far better at this than I. I also wanted to see if we had Chief Hansen still on the line, as his department has been really involved in this. We may have lost him just to the hour. But basically, a couple months ago, it was becoming clear that Cornell Med School with Dr. Mason was developing a saliva-based COVID screen to detect the presence of the coronavirus as an alternative to the nasopharyngeal, aka stab you in the brain approach to taking the COVID test. And so we began to have a conversation with the Medical College of Wisconsin and Cornell Med School, where I said to my brother, hey, you're doing this in New York City and some other places, why not your hometown? And we began to develop a really great protocol that poses this scientific question. Can you train a group of paramedics in a fire department to take samples and run tests quickly and succinctly to give people a quick answer on whether or not they screen for coronavirus with a saliva-based test? And so we put a lot of work into this, and our firefighters are doing amazing work on this as we speak, screening city employees. And so with that, I'm going to hand it over to Dr. Mason and Dr. Kriegel to talk about what we've been doing here at City Hall and the Annex with our fire department and our paramedics. Dr. Mason and Dr. Kriegel, please. If you could both take a minute just to introduce yourself and then walk through the program.
That sounds great, and thank you so much, Mayor Mason. And hello, I'm Christopher Mason. As you can see on the screen, Professor of Genetics at Weill Cornell Medicine, also physiology and biophysics, and you can see all the affiliations there, but basically just a geneticist at the end of the day. And
I'm Allison Kriegel. I'm an associate professor in the Department of Physiology at the Medical College of Wisconsin, and I do a lot of work in RNA.
Great, and I'll be presenting most of the slides here, but this is really on behalf of Dr. Kriegel as well as a lot of the staff you'll see some pictures of that have gotten the test up and running. And so I want to give everyone, I know it's late and there was a lot of debate on masks that went on, so I'm going to try and go through this pretty quickly and give everyone just a bit of background and then what we're doing and that what we have planned going forward. So where I'm coming from, as you can see here, New York Presbyterian Hospital and also Weill Cornell Medicine. This is our medical center in New York City. And as most of you also know, we got hit very hard. There were over 22,000 deaths in New York City. There was actually many nights in a row where all we heard where we live in New York City were sirens all day, every day, and all night, every night for about 3 weeks. So it was a really rough April and into May, but things have, of course, as you probably know, gotten better, but things have also moved around the country elsewhere. So we have been working nonstop, sequencing patients, working on clinical care at the hospital in my laboratory there since the pandemic started, and really want to think about ways we can track the virus faster, figure out where it's going. Also, we've been looking at why do some people get sick and some people not get sick at all, it seems. So there's still some really big unanswered questions, but it's really clear that it's can be a devastating illness for a lot of people and already has been. And what we also know is that the big problem outside of just the medical issues with the disease is that there are not enough tests. There's many, many articles you've all probably read about the need for testing as a way to, and there's a limited supply chains. Actually, just got off a call with our pathology department earlier tonight, where we can only get about 1/4 of the reagents we order at any given time. There are even after all this time, we still have shortages in the amount of supplies we have for tests at really nationally ranked medical centers and hospitals. And so, to that end, we've been thinking actually since the early days of the pandemic ways to make testing faster and easier. And most of you know that the nasopharyngeal swab is not pleasant. It's kind of like a cranionoscopy is what I've been calling it. It's not pleasant. And we're trying to think about ways to do it on saliva and easier testing methods. So one of the things that I'll show you is some early results. This is actually from the very first experiment that we ran back in the beginning of March, is where samples that don't have any virus versus clinical samples you can see would turn yellow, and other samples that were negative stayed pink. So we made an assay working with several collaborators in my lab and elsewhere that was really so simple you could see it, and also it worked within about 30 minutes from some of the very first. Very exciting. It was a protocol called LAMP, which I'll describe to you quickly. But it's similar to PCR. You've heard of these tests where you amplify one target. In this case, it's the virus, and try and just see quickly whether it's present. Now, for those of you who want to get into chemistry, which is probably not most people on city council, but to know what it is, normally what you do is you have these primers, they're called. It's kind of like Velcro that sticks to the target. It can be DNA or RNA. In this case, it's your RNA, which is the virus. And the reason we started to work on this is because this was first invented in the year, and it's something that's actually relatively inexpensive and something you can do really quickly using some of these enzymes called polymerases and reverse transcriptases that basically quickly turn the RNA into a target that you can amplify and then see. And so what we designed was a series of protocols and reactions that use these specific primers. And so for the details, you can see here's the sequences that perfectly match what's in and are complementary to the virus if it's present in a sample. And these are called loop primers, as well as these other 6 primer sets. And if the virus is present, what you'll see is when you make the reaction, and actually every time you incorporate one of these bases, an A, C, G, or T, that enzyme releases one proton, and it drops the pH of the solution, just like thinking of like a chemistry set where you could test a pool or a hot tub. Basically, it means that something that starts as pink, we include in here something called phenol red, and you can see here 0 copies of the virus, 1.
Anybody else?
Hopefully he'll come back. I guess the bottom line with this is that the more copies of the virus, so this is at 0 minutes, you don't see any color change. I don't know if we can go to the next slide.
Unfortunately, Christopher's controlling it, so.
Oh, darn. But anyway, when you first put no matter how much virus you put in at the beginning, all of the solution stays pink because there hasn't been a reaction yet. And I'll save the punchline for when he joins.
I'm gonna pause for just a second here.
Possible.
I'm gonna mute for just a second.
First time this has happened. Like, really. No one else has gotten hung up like that. Not like this.
So Allison, we're gonna skip ahead on the science a little bit and just talk about the work that you're doing to train the firefighters and paramedics in the fire department to actually do this testing?
Sure. So Weill Cornell Medical Center and some funding that Dr. Mason has gotten for this project really allowed us to set up a laboratory, in essence, right over in the annex across the street from the fire station. And so basically there are two key pieces of equipment that are needed to run this reaction. It's actually pretty simple. We just basically need to heat the solution, and then we need to measure how much fluorescence is there or color change. So we can measure either the color changes he talked about from pink to yellow. We also have a way that we can measure the actual a fluorescent signal that's indicative of how much virus there might be in the sample. And so we're utilizing those two pieces of equipment. I've trained several of the paramedics. So we have 3 different shifts of individuals that have been training on how to do this. So they've learned how to use pipettes. They've used how to, accurately measure. We have protocols written up, and they are doing an awesome job. So they've learned how to utilize the equipment. They've been trained in how to collect the nasopharyngeal samples, I believe, through training associated with the fire department. So that's been wonderful. So they're in great shape and ready to go. Mm-hmm.
Can you hear me now?
Yes.
Yeah,
Great.
we can hear you. We just gotta give you control back for the file. It'll take just a sec. But if you can continue talking about it.
Oh, great. You can see my screen. You're on slide 14. Is that what you see?
See nothing.
Presenter,
You see,
There you go.
Okay, so this is a good time to discuss internet connectivity and its importance for the world and how we all appreciate imagination in the time of failure of internet, but I appreciate everyone's patience. And okay, so now you can hopefully see my screen again here, where I think I was on this slide when you last saw it, right?
At zero time.
Zero. All right, the suspense might have been killing you all, but I appreciate your patience. So it's the reaction starts all pink, and you can see here from no copies of the virus up to 1 million, it stays the same. But once the reaction starts going, it starts to become yellow, and more yellow, the more virus is present. And after 30 or 40 minutes, the samples that are all yellow carrying the virus that at a detectable level actually all turn. So this is actually, the simplicity of the reaction is that it's very easy to just see the difference of what's happened. And in this regard, we were very excited about the initial results, but of course wanted to do additional validation in the early days of this test. In particular, we did synthetic RNAs that were the entire virus, and also where we could get down to very low copy numbers of the virus being present. So we're very excited by the initial results. And of course, we then wanted to test it with over 200 clinical samples. We could see from the samples we've tested in New York about 99% specificity and 96% sensitivity from these assays. And this data is all online. And then this has led to some expansion of the study in New York City. You can read about it here on the Cornell website of what work we're doing for the LAMP test and getting it from starting with the cheek and also getting to saliva. And moreover, this led to a collaboration with a company called Color Genomics for the first commercial site to get the FDA approval. We were working between Color and Harvard and our own laboratory to have this approved. So we're very excited that this method was designed, got off the ground, and got FDA approved for nasopharyngeal swabs. But as you've already heard, we're trying to get away from that in general and get to easier testing and also get to faster testing. So we've done at conferences where we've actually set up swabs and take people's phones, and we'll sequence the DNA of what's on someone's phone. And you might think it's totally gross, but you'd be amazed how many people would say, do you want to know what's on your phone? And then they'll look at me. You can see here I'm sampling someone's phone, and they'll say, well, I don't want to know what's on my phone. And then I'll say, well, you're using it to touch your face with it. You should probably want to know what's on your phone. But then sometimes they want to know. But this was in a pre-COVID time when people just were curious. But now it's something that here was just a fun exercise at conferences. We wanted to make it easier for people to get tested for a surveillance effort for a pathogen that, of course, we're all worried about. So in this regard, we knew it was possible to set up with relatively limited supplies at one site and get ready for testing. And so we basically, between the work that Dr. Kreigel has at Medical College of Wisconsin and some supplies that we've sent here to Racine, we've deployed about $250,000 of supplies and reagents here on site to do testing. And we're also working on getting smaller devices up and running. This is an example of something called the Tiny device, which is something you can carry in your hand. And we've also got our assay and our chemistry working on this device, which you can see is basically a very, very small reaction chamber where as the reaction occurs, you can do 6 samples at a time and get it working here on site. So as you can see here, we are doing it right now at the emergency room. This is Chris and Dan from my laboratory who are working there to actually get the testing running. And this is in the emergency room as patients are coming in. We're swabbing from saliva. And so the goal is to get it. So this is, not FDA approved yet for saliva, but it is for nasopharyngeal swabs. This is basically a study that's launched here to enable rapid testing so that we can amend the existing FDA approved test based on saliva, based on results being created right here in the city of Racine. The other advantage, as Mayor Mason said, is that it's really for on-site testing, not just being done by, scientists or people that have deep training in laboratory or bench work, but really it is a relatively easy protocol such that anyone could do it, even when you're doing pipetting. You can see here us getting set up. You can see Dr. Kreigel there, and also this is us on the first day we got started. But you can actually see here taking saliva samples, getting them really mixed and getting all the samples organized and labeled, and literally being run by firemen, firewomen, paramedics. You can see here loading the samples onto here the reaction goes and see how it starts pink, and the ones that are positive then turn yellow. And you can see basically here them also reviewing the results, discussing with each other. And at this point, we've done as of this afternoon, we've done over 200 samples. I also want to leave a little bit of time for Dr. Kreigel to describe her experience, but that's a bit of the background of the method, of the technology, and then also what we've deployed here at Racine to help out my hometown so that there's more testing options that also are not dependent on the same supply chain that is currently very much stressed. And so thank you again to Dr. Kreigel, all the firefighters, Mayor Mason, to the city, and then also, of course, to many collaborators and colleagues back in New York and elsewhere. And Dr. Kreigel, if you want to give any comments, and then we'd be happy to take any questions.
Yeah, I mean, I think you covered most of it. I think I just wanted to mention everyone how wonderful the fire department staff and first responders have been working through this. They're all very eager to learn and really excited to participate in this, and so that's been wonderful.
Great. And then we talked with the press a little bit earlier about this, but Christopher and Allison are both products of Racine Public Schools. Could you tell everybody how you met?
You do it this time.
We went. We were both on the bus on our way towards first grade. I was going to Red Apple, and we met. And so you would see each other on the bus on our way to elementary school. And then we stayed, and then also went to Case High School together. So we were both at Case. I was a swimmer. Allison was a runner. She still is. Also, her daughter just ran a, what was it, a 5-10 mile or something it was?
11, yeah.
5'11". So we stayed friends since high school and on Facebook. Actually, I went and gave a talk at Medical College, Wisconsin about 5 years ago and reconnected and been staying in touch since. And so when the outbreak happened, once New York started to become a little bit more, sane and we could actually start to breathe, we really were still working on this test and then started discussing, obviously, with Mayor Mason and thinking, well, what could we do to help out? And they said, well, I was still in New York. So I said, well, the closest person I know, we should contact Dr. Kreigel and see if she could help, and called up Allison and she said, sure, let's go, let's do it. So we got all the supplies, started shipping things out here, and then drove here cross country with my wife and daughter. I'm now staying in my sister's basement. Some of you probably know her. She's the teacher, Rosemary Mason. But anyway, we're here to just help and get more testing options available for the city and do everything we can to make it faster and keep people safe.
So I also just want to acknowledge the work that Dr. Kreigel did very quickly with the Medical College of Wisconsin to get that institution on board and to write the research protocol that we're employing right now. But for Allison and the Medical College, I don't know that we would be able to do this on the ground. So with that, I will stop and ask if there are questions that people want to pose to Dr. Mason or Dr. Kreigel. Alder Perez.
Thank you, Your Honor. Doctors, thank you very much. It is amazing work that you can do that. We toured the area, Alderman Young and I toured the area yesterday, and Alderman Peterson, and we were impressed that you can use that square of a room to accomplish all those things. How is the police, how is the fire department involved, and how are you funding their use in your lab? And what are you doing for disposal of the saliva and stuff? Because if you're doing DNA stuff, I want to know where my history is from. Just want to put it out there.
So I guess that I'm not really able to speak about, the funding, but in terms of involvement, basically, we have a group of volunteer paramedics that have been working on this and been trained. And so basically, they are helping with sample collection. And really important point here is they all have received hazmat training. So this is a very safe environment that's something we're really cautious of course, because we have to treat each sample like it might be potentially virulent, right? So that's one of the major challenges. The other thing, I guess, for disposal, so they're collecting samples and they're also processing and running the samples using that assay that Dr. Mason just mentioned. And then we are, additionally for disposal, I should mention, when we first get the saliva sample, one of the ways that we can actually get the RNA to be really, accessible for this assay is by heating it. And so when it gets heated for a certain period of time and length, it actually inactivates the virus. So it's no longer pathogenic, but that actually helps us to run our assay as well. So that's what we do. We have the individuals spit into a tube, we heat it, inactivate it, and then move forward with the assay. So what they're working with should be fairly safe. It's been shown experimentally in the laboratory that shorter and lower heating temperatures are enough to inactivate it than what we're using. So it should be really, fairly safe. But, the samples that are finished, we're disposing of them through like autoclaving approaches or incineration.
Okay, thank you. Thank you very much. And thank you for the work you're doing in our community too.
Oh, you're so welcome.
Yeah.
Alder Tate.
Thank you, Mr. Mayor. This is certainly want to give thanks and express gratitude to the team from Cornell Medical College of Wisconsin, as well as our local firefighters and paramedics for volunteering to be part of this, and obviously the mayor using resources to bring cutting edge research related to COVID to our community. Couple questions I have is just about the tri-party research collaboration agreement. One of the questions, obviously, it's common council, our job is oversight, particularly fiscal, to touch on kind of the scope of financial cooperation and expenditures associated with this. I know in the fiscal note it says the costs associated with the building improvements for the annex. I'm curious what the estimates might be around that, as well as what expenditures have already been furnished in the research, and kind of in what way have they been spent?
We can talk a little bit about the work that I'll ask Attorney Letney just to talk briefly. So whether or not paramedics are doing it, I think they did ask for volunteers to do it, but to be clear, they are being paid for their time. They're not volunteering in their spare time to do this. They're doing this while they are on the clock. So I just want to clarify that. And I'll just let Attorney Letney just talk about the understanding reached with the bargaining unit on that.
Right. So as Mayor Mason said, the firefighters that are doing this are on the clock. They volunteered to do it, but they are, it's during their regular shifts. Plus, they are each receiving a $40 stipend every day they're assigned. So they are getting paid a little more each day than the days they're doing this work. And that agreement is already in place based on the mayor's order. It expires in a year, assuming this were to go on. It goes on for a year.
I'll take the second half of your question.
Just as far as the costs associated with getting this space up to speed to do this work as well, I'm curious about.
Yeah, I mean, at this point, it's been pretty nominal. We're basically using the old boxing club space in the annex. There's an item later on the agenda for some additional space in the annex that actually has a hood and a sink and running water in it that would be helpful to be able to do this. Pretty nominal cost. And the nice thing about whatever build out that there is money available, being made available to us through the CARES Act and other federal funding to help do the work of testing and prevention around COVID that I'm going to ask Kathleen Fisher just to speak to that for just a second.
Yeah, I mean, just like the mayor said, the costs so far have been relatively nominal. A couple of window air conditioner or portable air conditioner units for what he referred to as the boxing club area of the annex. All of those are being charged right now again to the CARES Act funding under the Routes for Recovery Act. Definitely an eligible expense under that related to COVID, but we certainly haven't seen anything substantial yet.
Okay. And then just my last question, did it cost the city anything to bring these efforts from Cornell and through the Medical College of Wisconsin?
Yeah, I'll let Christopher answer. Not only did it not cost us anything, but I'll let Christopher explain.
No, the opposite. So just that has all been donated volunteer time on our end by both Dr. Kreigel and myself. So when they've been able to, so some of this is from philanthropic funding from a grant to Cornell that I've then brought the funding here to Racine. So The hardware, the machines you see in that laboratory, it's about $50,000 of hardware that the city will get to keep, assuming we don't need to move it somewhere else if there's an outbreak there or something. But and also the reagents, all the supplies, even though it's actually ends up being about $8 per sample per test. We've been able to cover that cost. So we can't do it forever. We committed to doing about maybe 10,000 samples from my own funding that I could bring to help the city. But hopefully the things like the CARES Act and other funding will help get things going beyond that. But we want to do, we wanted to help where run towards where the fire was and see if we could help put it out.
Thank you so much, Jim, for clarifying that, and also for bringing the resources that are amply at your disposal back home, and ultimately providing a service that hopefully we can also be a model for in terms of a less invasive, faster responding COVID test, so that we can get better data, a better response, and a better handle on this virus and how it's spreading through our community. So thanks again.
Absolutely, thanks.
Thank you, Alder Tate. Alder Peterson.
Yes, like everybody else says, thank you, Ms. Kriegel and Mr. Mason for doing this. Question is, what's the target for the number of tests daily? And when I was down for my visitation or whatever, they said they're testing the employees first. Are they testing them on a regular basis, or is it a one-time test and then you go to residents, or what's the protocol, and how? Like I said, are you trying to test the municipal employees once, or is it a multiple test like on a regular basis, or are you trying to get it out into the community? And what's the target for number of tests daily, please?
Yeah, that's a great question, Alder Peterson. The premise behind this initially was the first responders, not just to test them once, although we do want to get all of our employees tested at least once for baseline, but for firefighters who might finish a shift, or police officers who might finish a shift, a multi-day shift, that they could get screened multiple times, since they're interacting with the public pretty regularly, to help ensure that they're safe, and also for the public safety of the broader community. That allows us to maintain strength of force, or the numbers that we need to maintain the crews that are there. That was one of the initial ideas behind it. On this point, we have to walk before we can run. So we did a lot more tests the second week than we did the first week. The goal is to get to a place where we could do 1,000 or more tests a week. Right now we're doing hundreds. But if we can build up this capacity, the goal is to test city employees frequently, but then ideally open it up to the broader community as well, if we can build the capacity and scale up the pilot that we have going here. But we really need to make sure that this first phase goes well. I don't want to overcommit to being able to do more than we can handle. But I will say that having a great crew of firefighters who are adequately trained on hazmat and other skills, well, Allison speak to it directly because she's been working with them, but there was one researcher I spoke to who said you will never be able to train firefighters how to do DNA pipette samples. They'll never be able to figure it out. So Allison, you want to speak to that for a second?
No, they have been wonderful, and I actually think there's something about the other types of training and maybe that type of line of work where they're very comfortable following protocols and actually try really hard to replicate the protocols. I think that's an important part of their job as it is, and this is just applied in a different way. So they've done a really great job. And I think that it's just a different type of training. But I mean, like I train undergraduate students, graduate students all the time on pipetting. It's just, these are just, firefighters and paramedics instead of students.
But to try to sum up your question on where we go with it, Alder Peterson, the first phase is to try to do our own employees and build up the capacity to do more and more per week. And with the hope of, if this phase goes well, to hopefully be able to offer it to the broader community.
Okay, is there any type of time frame you're looking at?
I mean, I don't want to say, I think this week we did more tests than we did last week. I think as soon as we can, but I think it depends on how quickly it goes and what obstacles we might face and how quickly we can overcome them. But I wouldn't want to say in 2 weeks or in 4 weeks, we know we will be able to do what have you. It's part of the point of doing a research project is to learn as we go and report the data out and hopefully be able to scale it out from there. Christopher or Allison, now do you want to add anything to that?
I just was going to mention that, this is voluntary. So we have it written into the approved protocol that we could collect up to 100 samples from an individual over a year. And so what I'm really not sure at this point is how many employees are going to want to continue to get repeat testing. So once they're enrolled, we can keep collecting samples from them. I mean, ideally, we're sort of aiming towards a weekly or bi-weekly basis. But it really depends on how many people continue to want to get that sampling, when we could increase capacity to, offer testing outside of the employees.
Yep, and just in terms of scale, we have, we're doing in the ranges of dozens per day now, and it's not, I mean, we can do it. We know if you have someone well-trained in automation, you can do hundreds per day per person. So our ambition is to be in that range as soon as we can. If everything was in place, and we had everything, more hardware, more people, it's easy to ramp up fast. But I think it's, as soon as we can, because the more we can get testing out to the broader community, the faster we can trace any evidence of the virus.
Thank you very much.
Thank you, Alder Peterson. Other questions? Alder Tate.
Oh, no, my hand's not supposed to be up, but I'm shocked that Dr. Taft has no questions.
Yeah. Alder Taft is the only actual scientist on the council. Do you have any questions for our guest scientists?
No, they're both really excellent teachers. Great presentation. It's very exciting stuff.
All right.
Great, thanks. I'm glad to see scientists in government. That's great.
Yeah. Seeing no other questions,
We presently can't hear you.
Can't hear you, Mayor.
Weird.
I don't know how, but we got muted for a second there. My apologies. The clerk is going to call the roll. Once he calls your name, please vote as you wish.
Alder Miedema?
Aye.
Alder Tate?
Yes.
Alderwoman Glenn?
Yes.
Alder Santiago?
Aye.
Alder Perez?
Yes.
Alder Coe? I believe he's asked to be excused. Alder Peterson?
Yes.
Alder Levy?
Aye.
Alder West?
Aye.
Alder Land?
Yes.
Alder Horton?
Yes.
Alder Lemke?
Aye.
Alder Taft?
Yes.
Alder Jones?
Aye.
Alder Young?
Aye.
That's 14 ayes.
All right, passes unanimously. Again, our sincere thanks to Dr. Kriegel and Dr. Mason for helping out their hometown with this really great project to help get our employees screened and keep the community safe. We know that if we want to mitigate it, we've had a lot of conversations about masks, but we also know that increasing opportunities for screening and testing is going to be critically important to get ahead of this. So we thank them for this. And I'm really proud to be part of a project that I think is the only one in the country that's actually trying to have a city partner with institutions of higher education to train its paramedics to deploy a COVID screen. So we're very excited to partner with all of them on that. And thank them deeply for their help on that.
You're welcome.
With that, thank you very much. We will now, now I actually have to expel you two from the protocol for the meeting and take the screen back. So don't take it personally.
I think we're good.
All right. All right, great. So now we will go back to page 2 of the agenda. Hoping the remainder of the meeting goes a little bit faster. And I will ask Alder Taft, other than the first item that was on there, do you have any other items for separate consideration?
I have received no such requests.
Please proceed with your report.
All right, hold on. Water. All right. So we will begin then with item 394-20, communication sponsored by Alder Land on behalf of the City of Racine Forestry Department, requesting permission as a subrecipient partner with 1,000 Friends of Wisconsin to apply for and accept, if awarded, the 2020 Great Lakes Restoration Initiative, Forestry, Insect, and Disease Mitigation. Grant control number 00308. Recommendation of the Finance and Personnel Committee was that permission to apply for and accept, if awarded, the Great Lakes Restoration Initiative grant be granted. This grant will award $60,000 to our community to purchase 600 supplies and materials. A 25% match is required and will be met through funds spent on EAB management, tree planting, and in-kind. Next item. Item number 399-20, communication sponsored by the chair from the Assistant Finance Director requesting an authorization to carry forward various budget items from 2019 to 2020. The recommendation of the committee is that the resolution authorizing 2019 to 2020 budget carryovers be approved. Fiscal note, these are budget carryovers for commitments that were existing, encumbered, and funded in prior years, as well as projects that have spending periods over 1 year in length. There is existing funding in place for this action. Next item is 400-20, communication sponsored by the chair requesting authorization for the mayor and city clerk to accept a $3,183,723 grant from the Federal Transit Administration Low or No Emission Vehicle Program 5339 Grant Control 00291. Recommendation from the committee is to approve authorizing the mayor and city clerk to accept the grant from the Federal Transit Administration Low or No Emission Vehicle Program and agree to use the funds awarded under the Wisconsin Transit Capital Assistance Grant Program, the VW Mitigation Program, in 2019 as the local match. Fiscal note, these funds will be used in conjunction with the Wisconsin Transit Capital Assistance Grant Program, the VW Mitigation Program funds that were awarded to the city in 2019 to purchase 9 electric buses from Proterra and associated charging equipment. The Wisconsin Transit Capital Assistance Grant will be used as the match for these funds. The Common Council approved that application for these funds under Resolution 124-20. Item number 401-20, communication sponsored by the chair requesting authorization for the mayor and city clerk to accept a $990,171 grant from the Federal Transit Administration Bus and Bus Facilities Capital Grant Program. Grant control number 00330. Recommendation of the Finance and Personnel Committee is to approve authorizing the mayor and city clerk to accept the $990,171 grant from the Federal Transit Administration Bus and Bus Facilities Capital Grant Program and agree to use the funds awarded to procure 2 replacement diesel buses and replace the existing dispatch system. Okay. Fiscal note, the grant requires a local match of 20%. The match has been incorporated into the 2020 city capital budget. Funds will be spent out of account 602-820-1157310-82204, with the city match being transferred from 450105960. Item number 402-20. Communication sponsored by the chair requesting authorization for the mayor and city clerk to accept a $1,259,098 grant from the State of Wisconsin Department Administration under the Routes to Recovery Program for COVID-19, grant control number 00323. Recommendation is to approve authorizing the mayor and city clerk to accept this grant in the amount of $1,259,098 from the State of Wisconsin Department of Administration for the Routes to Recovery Program for COVID-19. There is no local match for the fiscal note. Eligible expenditures are being segregated in the city's ERP system under project number 10007-COVID-19 and will be submitted to the state for reimbursement when authorized. Next item is item 426-20, communication sponsored by Alder Young and a request by Matthew Sadowski, Executive Director of the Community Development Authority, seeking authorization to prepare and submit an application for an Economic Development Administration CARES Act application for construction assistance grant of up to $1 million for public infrastructure connectivity improvements for the CDA-owned property at 233 Lake Avenue. Recommendation is that funds and assistance available from the EDA CARES Act be requested and that the rules of the program be complied with. Further, that the interim executive director and/or chairman of the Community Development Authority or their designee be authorized to act on behalf of the CDA to submit an application for the CARES Act to assist with the construction of public infrastructure connectivity improvements for 233 Lake Avenue. Fiscal note: the amount of the grant being requested is $1 million. If the grant is received, a soft match of existing funds already committed to the redevelopment of the site is expected. No new dollar match is anticipated. Item number 427-20, communication sponsored by Alder Young and request Matthew Sadowski, Interim Executive Director of the Community Development Authority, seeking authorization to contract with the engineering firm of AECOM for technical support to develop an Economic Development Administration CARES application for construction assistance grant for connectivity improvements for the CDA-owned property at 233 Lake Avenue. Recommendation of the committee is that a contract between the CDA and AECOM for technical support in preparing the application for the EDA CARES Act grant be approved. Further, that the interim executive director and/or chairman of the Community Authority or the designee be authorized to act on behalf of the CDA to execute a contract with AECOM, sign documents, and take necessary action to undertake, direct, and complete contracted activities. Fiscal note: the amount of the contract with AECOM will be an amount not to exceed $24,900. There are sufficient funds in the tax incremental district number 14 for this request. Next item is item 447-20, communication sponsored by the chair on behalf of the city attorney's office, submitting the claims of 352 retired city employees regarding changes to the city's retiree health insurance plan effective January 1st, 2020 for consideration for disallowance. Recommendation of the committee is that the claims of 352 retired city employees be disallowed. Fiscal note is not applicable at this time. Next item is 450-20, communication sponsored by Mayor Mason on behalf of the Human Resources Director to enter into a contract with the Wright Academy, LLC for bias training within the Racine Police Department. Recommendation of the Finance and Personnel Committee is to approve the communication and that the mayor and the city clerk be directed to enter into a contract with the Wright Academy, LLC for bias training within the Racine Police Department. Fiscal note: contract not to exceed $56,000. Funds are available in the 2020 Racine Police Department budget. Next item number 453-20, communication sponsored by the chair, Alder Young and Alder Levy, providing an advisory referendum on the November 3rd, 2020 election ballot to measure public opinion on whether the Wisconsin legislature should create a nonpartisan procedure for the preparation of legislative and congressional district plans and maps. The recommendation of the Finance and Personnel Committee is to approve funding for an advisory referendum on the November 3rd, 2020 election ballot to measure public opinion on whether the Wisconsin legislature should create a nonpartisan procedure for the preparation of legislative and congressional district plans and maps. So that, I believe, exhausts the report of the Finance and Personnel Committee.
Thank you so much. Alder Peterson, did you have a question or an item you wanted for separate consideration?
Yes, I would like item 0447-20, separate consideration, please.
Okay.
Okay. Alder Taft, would you make the motion regarding 447-20?
Okay, move for separate consideration for item 447-20.
You don't need to move for separate consideration, you just need to make a...
Sorry, move to approve.
Okay, is there a second?
Second.
Seconded by Alder Young. Alder Peterson, did you want to speak on this item anymore, or you just wanted a separate vote on it?
I wanted a separate vote, and I want also everybody to know that I am not a claimant, although I am a retiree. So for me, I was somebody that did contract negotiations, and to me, it's pretty clear that it's just simple contract law, and the city will lose in this eventually, so. Just separate vote, that's all I want.
Okay. Is Alder Perez, did you want to speak to this item or a different item?
Yeah, I have a different item, but I would also like to see a separate consideration for 045020. And I'd like to stick to that.
Let me get through this one, and then I'll come back to you on the next one. Is there any other person who would like to speak to, or Alder who would like to speak on item 447-20? Seeing none, look, I'm going to open the roll. When the clerk calls your name, please vote as you wish.
Alder Mikma,
Yes.
Alder Tate,
Aye.
Alder Santiago,
Aye.
Alder Perez,
No.
Alder Coes has to be excused, Alder Peterson,
No.
Alder Levy,
No.
Alder West,
No.
Alder Lamb,
Abstain?
Alder Wharton,
No.
Alder Lemke,
Aye.
Alder Jones, Alder Jones,
Aye.
Alder Taft,
Aye.
Alder Young,
Aye.
Alderwoman Glenn has asked to be excused from the rest of the meeting. 1, 2, 3, 4. 7 ayes, 5 noes, 1 abstain.
Okay. Moving on to the next item, Alder Perez, you had an item for separate consideration?
Yes, Your Honor, 0450-20.
Okay.
I would like that for separate consideration. I have some questions on it.
Okay.
I'd like to move for separate consideration.
Alder Taft, could you make a motion, please?
Sure. Move to approve item 450-20.
Is there a second?
Second.
Seconded by Alder Perez. Alder Perez, please state your question.
Thing, I missed the discussion somehow, and I was looking at what was written, and I heard that the chief vetted several companies, and he was going to recommend Wright as part of the Wright Academy as part of the training. I'm wondering if there is more comment that can be made to kind of explain what is happening and the purpose for it, for this particular proposal. Can someone clarify it a little bit for me?
I'll let you direct your question to one of the members of the Finance Committee, perhaps, who brought this forward. Do you want to direct it to the chair or another member?
Yeah, sure. Chair's fine.
All right. Alder Taft?
Can you repeat the question, please? I'm sorry.
I didn't get the background to this other than that the chief vetted some companies and Wright Academy was what he thought was the best one. Can you give me a little bit more background or what the intent of this is, please?
Sure. So the chief, from my recollection from our meeting, the chief said that his main goal was sort of a bit of a culture change and sort of helping officers have some cultural understanding that may be different from their own. And he vetted many different. He vetted many anyway, different companies, and this one had a lot of positive feedback from law enforcement agencies that they'd worked with before. Chief Howell felt very confident that this company would be able to help him accomplish the goals. Another advantage of this particular company is that they have a train-the-trainer train the trainer model, so that they will,
Sure.
this wouldn't be just a one-off kind of training, that he's hoping to integrate sort of cultural awareness and cultural responsiveness into the Racine Police Department in general, and that this would be ongoing both with new officers and as well periodically with existing officers and staff. And so Chief, if I can paraphrase what he said, felt that this was a sustainable model. It was a model he was comfortable with. He had gotten multiple feedback from multiple different law enforcement agencies that this was, that they had positive experiences with this company and their training. So
Was this going
that
to
is
be
my,
okay?
that's
Was
my
that going to be a
understanding.
I'm sorry. Go ahead, doctor.
That's it.
Was this going to be a 4-hour training, 8-hour training, 40-hour training? Did we get any indication of what the parameters were for the training and how they're going to accomplish it?
I
Other
don't
President,
know.
if my recollection serves, it's a 2-day training.
But the intent is for it to go on, it be ongoing with trainers embedded in the department.
Okay. Thank you very much. That's all I needed to know. Thank you.
Sure. Happy to give assistance.
Any other discussion on this item? Seeing none, I'm going to open the roll. When the clerk calls your name, please vote as you wish. Alder Meekma.
Aye.
Alder Tate?
Aye.
Alder Santiago?
Aye.
Alder Perez?
Aye.
Alder Peterson?
Aye.
Alder Levy?
Aye.
Alder West?
Aye.
Alder Lamb?
Aye.
Alder Horton?
Aye.
Alder Lemke?
Aye.
Alder Jones?
Aye.
Alder Taft?
Aye.
Alder Young?
Aye.
It's going to be 13 ayes.
All right. Without objection, the remainder of these items will be placed on the consent agenda. We'll now move on to the Public Works and Services Committee report by Alder Jones. Alder Jones, did you have any requests for items for separate consideration?
I have one request, Your Honor.
Okay, and which one is that?
Item 0263-20,
Can you tell us what page that's on?
page 13.
All right. Would you like to read the item and make a motion?
Okay. Communication sponsored by the chair on behalf of Commissioner of Public Works. City engineer submitted revised state municipal agreement for state project ID 2440-09-00/70 Washington Avenue to Roosevelt Avenue to West Boulevard. Recommendation was to approve and authorize and direct the Commissioner of Public Works, city engineer, to sign the revised state municipal agreement for state project ID 2440-09-0070 Washington Avenue, Roosevelt Avenue to West Boulevard project. The estimated total cost of the project is $14,777,300, with the city share being 25% or $1,011,100, and the federal/state share being $13,766,200, which is 75%. Physical note funding for the city share is available in ORT Object 45040-57500, State Highway 20, west to Roosevelt. Move to approve.
All right, is there a second on the item? Seconded by Alder Horton. Alder Young, would you like to speak to this issue?
Yes, thank you, Mr. Mayor. Is there anybody from Public Works who's on the call at this late hour?
There is not.
There's not. Okay. Now, initially, I was going to make a motion to defer this item because I think there are a lot of questions relating to community engagement, access, accountability to ensure that this project gets done in a timely manner. But, I made an effort, as of late to reach out to the business community in West Racine, because this runs through my district, through Alder Perez's district, Alder Taft's district. But the West Racine Business Corridor is mostly in the 9th Aldermanic District. And so as this project gets underway, I just wanted to make sure that we had some answers to those questions.
One answer that I can give you without, in speaking to the Wisconsin Department of Transportation, if this was something we acted on our August 4th agenda, we would still be able to meet their deadline. And so I know you'd asked about, could there be more time for communication? I don't think we can wait forever on it, but if you needed to ask for a delay till our next meeting, it wouldn't hinder the schedule of the project.
So it wouldn't hinder any type of sewer improvements or any type of peripheral projects related to this?
It would not.
Okay. Well, then I would be, in order to make sure we have a thorough discussion about this, I would be in favor of deferring this until our next council meeting to ensure we have a proper discussion about this major project in a business district in Racine.
Is there a second? The second to defer this item. Alder Young, are you okay if we say we're deferring it until the next standing meeting on August, is it 4th? 5th. 5th, sorry, August the 5th.
Yes, I support that motion.
Okay. Discussion on deferral. Alder Tate.
Thank you, Mr. Mayor. I do want to clarify, you said we had until the 4th to get it to the DOT. Was that in error and you meant the 5th, or is that?
Yeah, I told him it would be that first Tuesday in August. I misspoke if I said it was 4th.
Okay, I just want to make sure that, there's not a date out there and we're choosing to meet after. So, okay, thank you for clarifying.
Good.
An important clarification.
The meeting's on Wednesday.
Okay. We have some reasonable amount of time to be able to do this and be able to do that. So the 5th will be fine. Other discussion on the item. Alder Perez, did you mean to still have your hand up, or was it up from before?
Oh, look for me for.
Okay. Seeing no further discussion, what we have before us is a motion to defer this item until our August 5th meeting of the council. I'm going to open the roll. As the clerk calls your name, please vote as you wish.
Alder Mikma?
Aye.
Alder Tate?
Aye.
Alder Santiago?
Aye.
Alder Perez?
Aye.
Alder Peterson?
Aye.
Alder Levy?
Aye.
Alder West?
Aye.
Alder Lamb?
Aye.
Alder Horton?
Aye.
Alder Lemke?
Aye.
Alder Lemke? Aye. Thank you. Alder Jones?
Aye.
Alder Taft?
Aye.
Alder Young?
Aye.
That is 13 ayes.
All right. So that item is deferred until the next meeting. Alder Jones, did you have any other items for separate consideration?
Not at this time.
Please proceed with your report.
Thank you. Item 0356-20, communications by the chair on behalf of Parks Department submitting change order number 1 on contract 202-00023 Horlick Athletic Field football turf installation. Recommended of Public Works and Service that the contract be approved and the deduct amount of $63,588. The overpayment amount of the change order to be appropriated in object 45050-57110 Park Land Improvement. Item 0384-20, Communication sponsored by the chair on behalf of Nita Dolores Hernandez Nessitz, Cake Room, requesting permission to place a sign over city right-of-way at 3214 Washington Avenue. Recommended that it be granted as requested with the stipulation that a hold harmless agreement be executed and $150 processing fees paid in accordance with State Statute 66.0425, privilege in streets. Physical note, there will be no cost to the city of Racine. Next item, 0386-20, communication sponsored by the chair on behalf of Public Works, submitting the 2020 sewer management service agreement, recommending that the agreement for the 2020 sewer management service, the AECom contractor. Physical note, the funding to defray the cost of these services is available in the following: $163,150, sanitary sewer number 22640, 57,560, $26,560 to the storm sewer account number 60484-57570 for a total of $189,710. Next item, 0387-20, communications sponsored by the chair on behalf of Commissioner of Public Works, John Rooney, submitting amendment number 1 to contract 202-00017, professional services, 2020 stormwater utility support service, AECom consultant. Recommended of the Public Works and Service that it be approved. Physical note, this amendment is to not to exceed amount of $7,300 with funding available in ORT Object 60484-52100 Stormwater Professional Services. Item 0388-20, communication sponsored by the chair on behalf of Commissioner of Public Works, City Engineer, requesting a 3-year financial commitment to the Wisconsin League of Municipalities for a leaf management storm water study. Recommendation to approve the Commission and Public Works City Engineer to enter into a 3-year agreement starting in 2021 in the amount of $1,000, annually $3,000 total, with the Wisconsin League of Municipalities for the leaf management stormwater study. Physical note, funding to defray the cost of this study is available in ORT Object 60484-52219, Public Information and Outreach. Next item, 0389-20, communication sponsored by President Tate, Alders Coe, Horton, Young, Land, Levy, Mi'kmaq, Perez, Santiago, Taft, West, Jones, and Lemke, on behalf of Scott Terry, to paint a mural containing the words "Black Humanity Now" in the city right-of-way directly upon Wisconsin Avenue, abutted by 7th Street and 8th Street. The proposed mural will be approximately 30 feet tall and 200 feet wide. Recommendation that the request be approved, subject to a hold harmless agreement being implemented. Physical note, there are no city funds being requested. Item 0391-20, communications sponsored by the chair, submitting the final resolution for the following street assessments: Alley, Portland Cement Concrete Paving; Alley, Washington Avenue to Wright Avenue, Dean Boulevard to Quincy Avenue; Alley, 15th Street to 16th Street, Grange Avenue to Fleet Avenue; Alley, Thurston Avenue to Quincy Avenue, Wright Avenue to 15th Street; Alley, Dean Boulevard to West Boulevard, 15th Street to 16th Street; Oakwood Drive, King Circle to Maryland Avenue, Southwood Drive, Taylor Avenue to Biscayne Avenue; Curb and Gutter, Oakwood Drive, King Circle to Maryland Avenue, Southwood Drive, Taylor Avenue to Biscayne Avenue. Recommendation of the Public Works that the final resolution be amended to delete Portland Cement Concrete Paving, Craft Apple Drive, Hickory Way to Cul-de-sac, Deborah Lane, Delaware Avenue to Winthrop Avenue, Monarch Drive, Emerson Hill Road to Regional Court. Bituminous Concrete Paving, Crab Apple Drive, Hickory Watt to the Cul-de-sac, Deborah Lane, Delaware Avenue to Winthrop Avenue, Monarch Drive, Emerson Hill Road to Regional Court, Oakwood Drive, King Circle to Maryland Avenue, Southwood Drive, Taylor Avenue to Biscayne Avenue, Curb and Gutter, Monarch Drive, Emerson Hill Road to Regional Court. Next item, 0451-20, communication sponsored by the chair submitting the final resolution for the following street assessments. Alleys, Taylor Avenue to Phillips Avenue, Slauson Avenue to Washington Avenue. Alley, Winslow Street to Maple Street, North Memorial Drive to Jones Street. Alley, 13th Street to Wright Avenue, West Lawn Avenue to Cleveland Avenue. Alley, West Lawn Avenue to Monroe Avenue, 13th Street to Wright Avenue. Alley, 17th Street to 18th Street, Park Avenue to Villa Street. Alley, 18th Street to DeKalb Avenue, Grant Avenue to Villa Street. Alley, 18th Street to DeKalb Avenue, Racine Street to Meade Street. Alley, 18th Street to DeKalb Avenue, House Street to Franklin Street. Alley, Remain Avenue, to Walton Avenue, Superior Street to Green Street. Recommendation of the Public Works and Service that the final resolution be amended to delete Portland Cement Concrete Paving, Alley, 13th Street to Wright Avenue, West Lawn Avenue to Cleveland Avenue. Alley, 17th Street to 18th Street, Park Avenue to Villa Street. Next item, 0429-20, communications sponsored by the chair on behalf of Public Works, submitting bid results for contract 2020047, parking map stair rail repairs. That no bid was received on this contract, and it is the intent to rebid this project. Item 0428-20, communication sponsored by the chair on behalf of Public Works, submitting bid results for contract 2020044, roof replacement, City Hall Annex. Recommendation that this contract be awarded to Carson Racine Roofing and Sheet Metal at the bid price of $132,782. Physical note funding for this work is available in Ort Object 45040, 57200 Annex Roof Areas 1, 4, 8, and 9. Next item, 042320, communication sponsored by the chair on behalf of Public Works, submitting bid results for contract 2020024, parking ramp improvement. Recommendation that this contract be awarded to Structural Works, Inc. at their base bid of $159,680. Funding for this work is available in Ort Object 60383-57200, parking system building improvement. Item 0424-20, communications sponsored by the chair on behalf of Public Works, submitting bid results for contract 2020042, roof replacement, City Hall. Recommendation that this contract be awarded to FJA Christensen Roofing Company, Inc. at their base bid of $389,204. Funding for this work is available in Ort Object 45040-57200, City Hall roof replacement. Next item, 425-20, communications sponsored by the chair on behalf of Public Works, submitting bid results for contract 2020043, roof replacement, Racine Public Library. Recommendation that this contract be awarded to FJA Christensen Roofing Company, Inc. at their base bid of $289,646. Physical note funding for this work is available in 45055-57200 library roofs 1, 2, 3, and 4. Next item, 0430-20, communication sponsored by the chair on behalf of Public Works, submitting bid results for contract 202-00048, roof replacement, Washington Museum. Recommendation that this contract be awarded to Koschak Roofing, Inc. at their base bid of $57,100. Physical note funding for this work is available in object 50008-57200, building improvements. 0431-20, communication sponsored by the chair on behalf of Public Works, submitting bid results for contract 202-00049, roof replacement, fire station number 2. Recommendation that this contract be awarded to Hernandez Roofing at their base bid of $67,725. Funding for this work is available in account 45030-57200, Fire Department Building Improvement. Excuse me. Next item, 0432-20, communication sponsored by the chair on behalf of Public Works, submitting bid results for contract 202-00050, roof replacement for Racine Heritage Museum. Recommendation that this contract be awarded to Hernandez Roofing at their base bid of $146,620. Funding for this work is available in object 45040-57200, Historical Museum Roof. Since Racine County is leasing this building for the Racine Heritage Museum, they are responsible to cover 50% of this project. So we will be responsible to cover $73,310 on this project. Next item, 0433-20, communication sponsored by the chair on behalf of Public Works, submitting bid results for contract 202-00053, roof replacement, bus transit center garage. Recommendation that this contract be awarded to Carlson Racine Roofing and sheet metal at their base bid of $84,440. Physical note funding for this work is available in 45010-59600, bus roof replacement transit garage. Next item, 0436-20, communication sponsored by Alder Jones on behalf of Public Works, submitting change order number 1 on contract 202-00029, roof replacement central heating plant. Recommendation that change order roof replacement central heating plant and the new installation necessary be approved for the amount of $8,245. Funds to cover the cost of this $8,245 change order is available in building improvements account 45040-57200. And that is the end of my report.
Thank you very much. Alder Peterson, do you have a question or an item you wanted considered separately?
Yes, item 038920 for separate consideration, please.
Could you say what page that's on, please?
Page 10.
That is on, wait a second.
Is that page 10?
Alder Peterson, could you repeat yourself?
It's on page 8, top of page 8.
Okay.
038920.
All right. Alder Jones. would you like to make-
0389-20.
Yep.
Yes, ma'am.
Move to approve.
Move to approve the item. Is there a second?
Second.
Second from Alder Land. Alder Peterson, do you want to speak on the item?
Yes, please. Just for some clarification, question from the city attorney. I don't know if you read the article. I sent it to all the aldermen as well, where similar street art has been removed due to concerns that once you put it in a public domain like that, it opens it up to other political and social requests. So my question to the city attorney is, once we put that out there, are we subject to similar political and social requests? Can we turn down other items like that? That's the first question.
Alder Letton, or I'm sorry, Attorney Letton? Getting late.
I did read the article, and Alder Peterson, I'm aware of similar concerns that well pre-exist the issues that are going on today. The city has in the past approved, I'm going to just generally call them street art projects. Walden School, I think actually did one. There were a couple others that were approved, at least since I've been here, but I don't think came to be. Again, I don't want to make hypotheticals up and then issue legal opinions based on hypotheticals, but I will say, generally speaking, a municipal government may not make content-based restrictions on speech. So if this is approved and somebody wants to paint something else, they want to say "Go Brewers" or something like that, the city probably couldn't say, "I don't like that message." There are some areas in which commercial speech and things like that, there maybe will be restrictions, but in accordance with the previous agreements that we've had for people that want to create street art, I sent Mr. Terry an agreement that, again, is consistent with what we've done before, that the design and layout has to be approved by the Commissioner of Public Works, that there's an indemnification and hold harmless agreement, that the requester obey all laws and regulations, that they wear orange safety vests while working in the right-of-way, that they comply with all safety requirements contained in the manual on uniform traffic control devices, that they use a specific paint that's called aggregate paint, that they're required to perform maintenance or repair of the image at least annually. If the city has to incur costs for maintenance, then the city can bill the requester. The city's agreeing that they can paint this image in the right-of-way of the 700 block of Wisconsin Avenue. There's some legal language that says the requester is not an agent or an employee of the city, just for our purposes in case somebody's hurt, so there's no workers' comp involved. That if the image creates conditions adverse to the best interest of right-of-way users or the general public or presents a threat to safety, then the requester, upon notification by the city, shall remove the image. This agreement, consistent with what we've done in the past, is for a period of 2 years. Let's see, if anybody wants to sue based upon this, they sue the requester, not the city, and that's the language that we include.
Thank you very much. I'm assuming the aggregate takes care of the change of surface?
That's my understanding. That's a public works issue, but that's the kind of paint that they want us to say that they should use, aggregate paint.
Okay. All right. And last question is, my understanding is we're trying to move forward relatively quickly as to turning Wisconsin Avenue into a two-way street with moving to Highway 32 and changing Wisconsin and Lake Avenue and all that. Does that affect this at all?
I don't think so. Any lane markers, any parking space markers, whatever else is supposed to be in the street still has to be able to be painted in the street, notwithstanding whatever street art is there. I don't think this would affect that, and I think the plan is to do it over, I guess I'm assuming Labor Day weekend because it's a 3-day weekend, at least that's what I have been told.
Right. I just wasn't sure if when you go to a two-way street, whether or not that's going to affect the lane marking, being that you generally have a yellow down the middle and whatever. So as long as that's not going to be an issue, I generally don't have an issue. I'm just bringing up concerns. That's it for me. Thank you very much.
Thank you, Alder Peterson. Anyone else? Seeing no other members of the council wishing to speak on this item, I'm going to open up the roll. When the clerk calls your name, please vote as you wish.
Alder Miedema?
Aye.
Alder Tate?
Yes.
Alder Santiago?
Aye.
Alder Perez?
Yes.
Alder Peterson?
Yes.
Alder Levy?
Aye.
Alder West?
Aye.
Alder Land?
Yes.
Alder Horton?
Aye.
Alder Lemke?
Aye.
Alder Jones? Sorry, Alder Jones?
Aye.
Alder Taft?
Aye.
Alder Young?
Aye.
That is 13 ayes.
Alder Peterson,
Yes.
your hand is
Yes.
up. Did you have another item for separate consideration?
No, I'm sorry. I just forgot to raise it. Sorry. Forgot to
That's all
lower.
right.
Thank you.
Then without objection, I will put the remainder of the items on the public works agenda onto the consent, or on the public works report onto the consent agenda. Moving on now to public safety and licensing, Alder Coe had to return to his employment. So Alder Lemke, if you wouldn't mind, do you have any items you know of for separate consideration?
I have not been asked for any separate consideration at this time.
Could you please proceed with the report?
Absolutely. So just as a page marker for those who might be following along, we're at the bottom of page 13, one sentence, so you can start at the top of page 14. Item 0299-20, communication sponsored by the chair on behalf of Public Safety and Licensing, requesting the appearance of Aaron Morris, agent for Eggplant Cafe, pursuant to a formal expression of concern regarding not maintaining regular business hours, in an update on the agent. And we recommended that be approved. They're looking at having other tenants move in there. Item 0301-20, communication from Alder Coe on behalf of Public Safety and Licensing Committee, requesting the appearance of Dorothy Lee, agent for Tropical Paradise at 1600 Douglas Avenue, pursuant to a formal expression of concern for not having an operating business location, and also requesting consideration of rescinding the formal expression of concern. The recommendation was to deny the license as there is not currently, they do not currently have a building. Item 0302-20, communications sponsored by Alder Coe on behalf of Public Safety and Licensing, requesting the appearance of Tessa Santoro, who is doing business as the local at 501 6th Street, pursuant to a formal expression of concern of not having regular business hours and not being operating for 2 years. The recommendation of the Public Safety and Licensing Committee was to deny the liquor license. Item 0307-20, communication by Alder Coe on behalf of Public Safety and Licensing, requesting that the renewal application for Jalisco Michoacan at 1950 Racine Street appear. The recommendation was to approve the license. Item 0308-20, communication by Alder Coe on behalf of Public Safety and Licensing, requesting that the American Legion Post 546, located at 1234 Douglas Avenue, appear. Let's see, and the recommendation was to approve the license. Item 0323-20, communication sponsored by Alder Coe, submitting an application for a Class B retail fermented malt beverage and intoxicating liquor license for the Corner House on 207 Gaslight Circle, requesting that they appear. The application was approved. Item 0395-20, communication sponsored by Alderman Coe for a Class A fermented malt beverage and intoxicating liquor license for an establishment at 3818 Durand Avenue in the 11th District, requesting that they appear. The application was approved. Item 0417-20, communication from Alder Coe submitting a Class B retail fermented malt beverage and intoxicating liquor license application for Deja Vu Cooking, which will be at 240 Main Street. The application was approved. That will be a new sort of Jamaican kind of cooking restaurant downtown. That'll be good to have. Item 0418-20, communication for Alder Coe submitting a Class B retail fermented malt beverage and intoxicating liquor license for Rudy's, which is at 2515 Douglas Avenue. Recommendation that that be approved. And that is all the items on my report.
Without objection, these items will be placed on the consent agenda. Moving on then to the Planning, Heritage, and Design Commission. Alder Young, do you have any items for separate consideration?
Not at this time, Mr. Mayor.
Please proceed with your report, sir.
Thank you. Item 0219-20, a public hearing regarding a conditional use permit issued to Bradley and Michelle Hardy of Grandma's Home Away from Home Daycare at 2925 Rapids Drive. Recommendation from the PhD Commission that it would be approved, subject to conditions A through H. Item 0220-20, a public hearing regarding a conditional use permit issued to Wesley Rosenberg of Building Waters Incorporated to operate a building materials sale and storage facility at 3811 21st Street for an HVAC business. Recommendation of the Planning, Heritage, and Design Commission is that this business be approved, subject to condition A through G. Item 0327-20, request from Erica Bozinvosky, representing Sweatshop Movement Incorporated for a conditional use permit for recreation building at 2723 Carlisle Avenue. That this be approved, subject to conditions A through F. And that is the end of my report, Mr. Mayor.
Thank you. Without objection, these items will be added to the consent agenda. Moving on then now to the Executive Committee report. Alder Kate, did you have any items for separate consideration?
None other than the one we already discussed.
Okay.
So item 0475-20, communication sponsored by Mayor Mason on behalf of RCDC, requesting that the City of Racine Common Council approve the revolving loan fund plan and addendum for the administration of the U.S. Economic Development Administration EDA Business Loan Program. Item 0472-20, communication sponsored by Mayor Mason, requesting to adopt ordinance 0005-20, CDBG Advisory Board membership. And item 0452-20, communication sponsored by Mayor Mason, submitting the lease agreement for Toys for Tots. That's it.
Without objection, these items will be added to the consent agenda. Alder Tate, could you please proceed with the Office of the Mayor report?
Certainly can. Item 0470-20, communication sponsored by Mayor Mason, submitting the appointment of Kathleen Fisher to the interim city administrator through January 31st, 2021. Fiscal estimated costs of the $13,000 funds are available in the 2020 budget, which would be as a result of taking on that position. Item 0471-20, communication sponsored by Mayor Mason, submitting the following appointments. Alder Lemke to the Board of Parks and Recreation and Cultural Services with a term ending April 20th, 2021. Alder West to the CDBG Advisory Board for a term expiring April 17th, 2023. And Alder Taft to the CDBG Advisory Board for a term expiring April 17th, 2023. And Shannon Powell to the Standing Joint Review Board. For those not familiar, I believe the Joint Review Board is the collective review board for the county, the school district, and the city. Is that right? So certainly should have city representation on there. Item 0474-20, communication sponsor. Oh, yep, we did that one. So that's everything. I'm done.
Okay. Without Alder Lemke.
Can I just ask really briefly, can you like add somewhere when Shannon's term or how that exactly works? But I mean, I don't have an issue with it. Just please add the note.
Yeah, I'm going to ask the clerk to speak to that, if I may.
I believe that he is filling the position that Jim Palinik left, so therefore, until an official appointment would be made, he would sit in on that position. So that technically is for the administrator, is my understanding of it.
That is not true.
Oh, it's not true, am I off? Oh, I apologize. Go ahead.
No, so there has to be a city member appointed to the Joint Review Board for the City of Racine. Shannon Powell is a city resident of the City of Racine, so he is taking the place of, Tara was right in that, the place of Jim Palinik. In terms of the end of the term, I'm going to be honest with you, I don't think there is a term limit on Joint Review Board.
I don't know if that one expires.
My hand is, yeah, I would say.
Oh, go ahead.
I don't have any problem, I don't have any concerns with Shannon serving, but I would like to see a date on it. Everything else has a date, so I think we should review it just like everything else. So, if there is really no date, if we just want to say 2023 in conjunction with some of these other appointments, that's fine, but I think everything should have a review date.
The Standing Joint Review Board is statutory.
Right.
It's kind of ad hoc.
Right.
Whereas these others are mainly defined by ordinance.
I mean, if nobody thinks we should review who's on these boards periodically, that's fine, but I get that it doesn't have a date, but I'm saying we should just assign it one. I don't have a problem with Shannon. I don't have a problem with anything, but I mean, unless we want to just say to eternity, I think at some point, and I don't have a problem with Shannon. I like Shannon, but everything is reviewed every 3 years or whatever. And we don't have to, but I think we should. So I guess I would propose an amendment to, just make it coincide with April 17th, 2023. And if that's 3 years, we can review it, and we'd love them, just keep appointing it. But I just think everything should be reviewed periodically.
So are you making a motion?
Yeah, I'm just saying let's review it April 17th, 2023.
So Alder Lemke, I think it's going to take a couple minutes for the city attorney to review it. Again, this is a statutorily driven committee, not a ordinance driven one. And so we're going to need a couple minutes to figure that out.
I don't think it's done. I've looked at this before. It's just
Quick question, point of order.
Sure.
If we're doing a separate consideration, aren't we supposed to, isn't there an order for that as to bringing it out?
So, yeah, technically you would need to ask for separate consideration of this. Alder Peterson, I think we're having the city attorney again, because this is a statutorily driven committee, not a city ordinance committee, we're doing a bit of research
Right.
here to see if that's
I
appropriate.
understand. I just figured I'd get a point of order out there while you're looking.
Okay, then I request separate consideration without objection.
Sure.
And Alder Lemke, do you want to pull out, well, actually, let's just do it all at once, because then it's just easier.
So Shannon would be appointed as the public member.
Right.
And the public member and the chair, by law, stay on the board for as long as the TID exists, or until they're not needed anymore. So it's statutorily kind of open-ended.
Well, not open, I mean, the TIDs do exist
Well,
for a certain
right, for a certain number of years. I mean, it's a long time.
So
but-
currently, our longest existing TID is something like 2042.
Right.
Mr. Mayor?
Yes.
This question would be then directed to the city attorney. So with that being the norm and the understanding with the joint review board, are you saying that the council doesn't have the authority to create a term limit that then would come back to the council for review?
The joint review board dealing with tax incremental districts is statutorily defined. So I guess I'm agreeing with you that state law defines joint review boards, and they come from, each member comes from a different place. And if Shannon's the public member, they just continue.
So I think the public, I would say, I think the public needs to be aware of that. So if it's until 2042, say it's until 2042, but don't just put it out there like it's this eternal thing. It needs to say whatever it is, even if that date's 2042. I mean.
Can we move to defer, or would that be in order at this time?
I'm just asking someone to put a notation of the date. You don't need to change anything. Just add the date. When does it expire?
The problem, Alder Lemke, is there's multiple TIDs that this board will create, and they will run for different lengths of time. So some of them may be 15 years, some of them may be 27 years. I appreciate the sentiment and what you're getting at, and believe me, at this late hour, I don't think anybody's trying to be obtuse. It's just that this is different than other appointments for a reason that's defined by statute.
Okay, then I would motion to pull it out until we are able to approve the other ones and pull that one out until we're able to give people some sort of idea about when we're reviewing these things.
Is there anything that needs to be done between now and August 5th?
I don't think so. Is there a second for the motion to defer this item until the 5th? Alder Peterson? No, your hand's up, sorry. All right.
Alder
Just ask what the
President.
is there what the consequences would be of deferring this?
Right. That's.
So again, I don't think that there's anything that the Standing Joint Review Board needs to do between now and August 5th. I don't think the answer is going to be different between now and August 5th. But but there's nothing that would, there's no scheduled Standing Joint Review Board meeting at this time. It's hard for me to imagine that one will be required between now and August 5th. But it is possible it is going to need to meet in August. So I don't think we can go much beyond that.
Second to defer to August 5th, if we needed a second.
All right, all those, clerk will open the roll. All those in favor of deferring this item, actually, I'm sorry, getting tired here. Clerk will open the roll. Please vote when the clerk calls your name.
Alder Meekma,
Aye.
Alder Tate,
I'm sorry, Alder Tate?
Aye.
Alder Santiago,
Aye.
Alder Perez,
Yes.
Alder Peterson,
Oh, that's different. There's 5,000 people there. This thing's got, this
I'm sorry, Alder
gonna
Peterson,
change.
No, mute yourself.
Alder Levy,
Aye.
Alder West,
Aye.
Alder Lamb,
Aye.
Alder Horton,
Aye.
Alder Lemke,
Aye.
Alder Jones,
Aye.
Alder Taft,
Aye.
Alder Young.
Aye.
13 ayes, 0 noes.
All right. Any other items for separate consideration? Seeing none, the remainder of these items will be placed on the consent agenda. At this time, we will move on to the consent agenda. Alder Tate, I would entertain a motion to approve the consent agenda.
Move to approve.
Second.
Seconded from several people. All those in favor of the consent agenda, please say aye.
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 All those opposed? Motion carries. We're now on to common council announcements. I would plead for brevity. If you would like to make an announcement, just remember it can't be about anything on the agenda or anything having to do with public policy that we've discussed. Anybody wanting to make an agenda or anyone wanting to make an announcement at this late hour? Seeing no one, thankfully, Alder West, would you like to make a motion to adjourn?
Yes, move to adjourn.
Is there a second? Multiple seconds. All those in favor, please say aye. Opposed? The ayes have it.
I'm all set now. I'm done. I took off work. So I
Jeff,
can
go.
get back out now.